election waiver. We have 9 requests to speak on this item, 4 in person and 5 requesting to speak by phone. Also note for the record that we received 1 comment in opposition. For any individuals that requested to speak on item 3 by phone, please dial in the conference line using the instructions that were provided to you. We'll begin with the in-person speakers. As your name is called, please report and stand on the arrows until it's your turn to speak at the podium. You'll have 2 minutes to address the board unless you begin by stating your name for the audio record. I'd like to invite forward Cesar Javier, Leslie Adra, Michael Brando, and Mark. I call your name. Please forward.
About a healthcare service for the sheriff, and it's interesting because when we engage with these types of entities, they are, the make or break of whether or not somebody is going, if there was a claim filed, and whether or not they're actually going to get health care. If something happens on the job, and whether or not that was something that they should cover. So we'll see kind of how this goes, but it's interesting because, there's much of the time things that will happen to people on the job and they don't necessarily get full coverage of things that may happen. These entities determine whether or not it's something that they're able to get coverage for, meaning that, like, say they got into an accident and they already had some kind of damage to their mouth and they had teeth issues. They're the ones that are going to be coming in and determining whether or not that is something that they could make a claim about. And that's the sad thing, is that, much of the time when people are trying to get help, there's always gatekeepers in the way of whether or not they're actually going to be able to get the health care coverage that they need. By saying that potentially they already had another issue and we're not going to cover it. And it's just sad that, we pay into these types of entities and they're the ones that will determine whether or not you're actually going to get the care, which is, can be good or bad, but it can be bad if entities don't want to pay for a certain amount of coverage or a certain coverage that somebody actually needs, and it keeps them from being able to get something fixed if they need to. So hopefully this is going to, be beneficial, but most of the things you guys do aren't. So, yeah.
Thank you. Next speaker, please.
Mark, so, well, obviously it's necessary to have medical coverage for the people in jail. I don't like the fact that the pharmaceutical companies and the doctors, and it's not especially the doctor's fault, they're actually just bound by the rules that they can't really go against the AMA. So when they look up something on the computer, if someone has a medical condition, they're depressed, they have anxiety or whatever, they go to a page, and pharmaceutical companies can just pay out, pay for a wing of a university at someone's medical school or whatever. And of course, they get things in the textbooks, and if it says to give them Xanax or whatever it is, they will. So I don't like, I was just reading the overview, and I don't like the behavioral health. And the fact that, now this is the title of a YouTube video. If people see this from 6 minutes, 40 seconds to 24 minutes, it will describe the Federal Reserve System that's intentionally causing inflation. And it's making people poor. That makes people more stressed out, crazy, and commit more crimes. So they wind up in jail. And then pharmaceutical companies make a lot of money off of it through the Medicaid program that this is being, they're being given on our taxpayer dime. And a lot of the people, the drugs they give them make them much worse. And it's funny, you see this all the time on like regular TV, free TV, over the air for seniors, commercials in between every program saying, it'll stop you from farting, but it might kill you and give you a brain aneurysm. You know, I'm making up a facetious example, but it's really not ridiculous. So everyone needs to see this. This needs to stop. These people are being taken advantage of, and it's tragic.
Thank you. Madam Call, Procedure Javier, Mike Brendel. Not seeing any movements in the chamber, will now hear from the individuals that requested to speak by phone. We will begin with our first caller.
Okay. Excuse me. Paul LeBeau. There's got to be a way, a better way than a multi-year contract with a questionable care provider. AmeriChoice is part of the United Healthcare system, a big organization which does not, frankly, prioritize individual needs. It is using AI, artificial intelligence algorithm called MH Predict, whose wildly inaccurate predictions, let me repeat, wildly inaccurate predictions are being used to deny health coverage to severely ill patients, cutting their time in extended care, resulting in at least 2 deaths. UHC patient reviews are predominantly negative across consumer rating platforms like Consumer Affairs and Trustpilot, both rated at a 1.3 out of 5. Users report many claim denials, along with customer service and difficulty navigating coverage, notes Consumer Affairs. Yelp also rates UHC 1.5 out of 5. Not good. Given the way the county does business these days, did you just move to review this, or did you actually research the pros and cons? Maybe you look up some other providers. Why do you want to lock yourself into a multi-year contract with a clearly underperforming provider? I mean, you should do periodic quality reviews, and if they're not performing, just cut the contract.
Thank you. Here's the next caller. Next caller is Consuelo. Your device might be muted.
Hello, can you hear me?
Yes, yes, we can hear you now. Please go.
Hello? Okay, great. Okay, how many minutes do we have on this, Andrew?
You have 2 minutes, Consuelo.
Andrew popped up. 2 minutes? I'm sorry, 2 minutes?
Yes, that's correct. You have 2 minutes.
Okay, thank you. Okay, I hope you didn't start my time, but you probably did. Okay, speaking on the item authorizing the amendment with the United Healthcare. Okay, this is where we really need to pause and ask what exactly are we investing in, because what we call healthcare is in reality sick care. It is one of the most lucrative industries in existence, as I mentioned before, and when an industry profits off of illness, there is no incentive to create a truly healthy population. Okay, so a cured patient is revenue lost. Okay, broken record. So what do we see instead? Lifelong prescriptions, endless treatments, management of symptoms, instead of addressing the root causes. That's definitely not healing, and that's mostly a business model. And these contracts, like the one with United Healthcare, only continue to feed that model. They contribute to a system that keeps people dependent, docile, and frankly weaker over time. Because a population that is tired, medicated, and disconnected from their own bodies is much easier to what? Control. Meanwhile, the solutions that are that actually support real health, nutrition, minerals, detoxification, sunlight, movement, nervous system regulations are either ignored, dismissed, or completely left out of the conversation. So I have to ask, why is the county contracting why isn't the county contracting with real naturopathic doctors? Why aren't we investing in prevention and education of the body, the mind, and the spirit, and empowering people to understand and take care of their own bodies? Because the goal is truly health, that's exactly where the focus would be. But it's not. And more people are starting to see that. They're questioning it, they're waking up to it, and they are realizing that the true healing was never meant to come from a system that profits off.
Thank you. Here's the next caller.
Hey, it's Truth. I'd still like to know why this item was withdrawn during the March 3rd meeting. Why can't this chair, 10% from Tara, as confirmed by DA Summer Stephen today, be transparent about what's going on with items that magically appear or disappear from the agenda? It looks like I was right, that NASCAR sucks, and now must be replaced, allegedly. It's a $13.9 million contract with United Healthcare Services doing business as AmeriChoice as the proposal. But can the progressives support that, or does it fill them with violent thoughts to happen? They claim they don't like that company. I don't know, is that what happened, or something different behind the scenes? And with this high quality care for individuals in custody that the Biden speaks of, there's been record amounts of inmates dying in county jails. It seems like they're lucky to get any care at all. Another question, does the alleged care include drugs and surgeries as part of gender denying care? This would again include taxpayer-funded health care for illegal aliens being housed within county jails rather than being deported like they should be. Did Queen Mamula pull this item so she can give a 20-minute monologue against King Trump because she envies his power? Is this another item where Tara Monica and Marianette Mamula did not consult with the public safety experts on what the best choice is? Or they've gone against logic to push personal, political agendas at the expense of taxpaying residents? NASCAR had a medical cap of $20 million. Somehow that wasn't enough. Does Universal have no cap? Is that the deal with the extra $25 million a year cost? You know, do you guys have any idea how to do basic math, basic budgeting? What about QuickBooks like Santac users? It's just amazing the corruption that goes on with this board under the progressive reign of terror. I hope you guys get a conscience one of these days.
Thank you. Now here's the final caller.
It's amazing the fact that Damon just took a pay cut in order to become our lawyer. Not coincidental, probably not coincidental too that Governor Newsom appointed the judge that gave me the restraining order. And it's probably not coincidental the fact that 4 lawyers got golden parachutes that went after me. All these things aren't coincidental. You guys, what? Will you ever do the right thing?
Thank you. This is item 3. Sheriff, request approval to authorize an amendment with United Healthcare AmeriChoice and authorize competitive solicitation for an administrative services organization. This is your first warning. If you speak again on topic, you will forfeit your time. Thanks.
No problem. You guys are forcing me to go through therapy because I cannot handle the fact that you refuse to answer basic questions. And you pretend that you're not on the other end of the line when I call up your office. And for that, I'm being forced to go spend an ungodly amount of money in a industry that I don't.
Thank you. That was not relevant or pertinent to the conversation. Thank you. Moving on to the next speaker.
Thank you, Chair Buster. That concludes public comments.
Okay. So we have item 3. Obviously, this was continued previously. I know that there's some interest in this. This was pulled from consent by Chair Pro Tem Geary. Open up for board discussion. So Supervisor Dustin.
Move to approve.
Okay. We have a motion to approve. We have a second. A motion and a second on the floor. Chair Pro Tem.
Thank you, Madam Chair. I believe there's a presentation.
We can. absolutely. Sheriff Martinez, if you'd like to come up, or like to come up, or maybe be willing to come up, that would be great. And if you, you're welcome to make a presentation if you like, before you answer the sheriff's questions.
We can do presentation if you like it. Okay, can you get
Beyond currently experienced in healthcare, and one of the things that's very important to hospitals, and so AmeriChoice, we know, will be able to do that as a local company. NAVCARE also was unable to get Medi-Cal reimbursement for a number of services, primarily pharmaceuticals and some others, so CalAIM is not, we are not seeking CalAIM reimbursement where we believe that we can, so we're hoping to generate some money back through the CalAIM process. So those are two of the motivations for this change. I'm going to have Commander Jesse Johns kick it off from here and present a presentation. He's my medical, the commander in charge of our medical services division, and then we'll open it up to questions if you have some after the presentation. Thank you.
Good afternoon, Board of Supervisors. First, I would like to take the opportunity to provide a high-level historical overview of the NAVCARE Medical Services contract and how that comes into play for today's discussion. In 2022, the Sheriff's Office, under the leadership of previous Sheriff Bill Gore, consolidated more than 20 medical contracts into a single comprehensive contract, which was awarded to NAVCARE. NAVCARE is contracted to provide comprehensive on-site and off-site medical, mental health, dental, and specialty care for individuals in custody, including coordinating hospital care, utilization management, and claims submission. On September 12, 2023, an on-site clinical service RFP was presented to the Board of Supervisors, and after the solicitation process, the contract was June 1st, 2024. On July 12, 2024, the NAVCARE contract was amended to set a $20 million off-site medical cost cap. Prior to this, any off-site costs that exceeded the cap were paid by NAVCARE. Responsibility to the Sheriff's Office. On December 9th, 2025, a pharmacy RFP board letter was approved by the Board of Supervisors. And lastly, today, the Sheriff's Office is requesting to move Administrative Services Organization services from NAVCARE to AmeriChoice. In recent years, the Sheriff's Office has experienced an increased incarcerated population that requires high-level medical care. In order to identify a need for a higher level of care, the Sheriff's Office has enhanced assessments at intake. I would like to highlight a sample of statistics to provide an understanding of the medical services rendered. For calendar year 2025, our average daily population was 4,174, whereas the previous calendar year was 3,892. This is a 7.2% increase year over year. We have a total of 30 on-site medical providers working under the Correctional Healthcare Partners on-site physician contract. In calendar year 2025, the Sheriff's Office facilitated 2,845 emergency department send-outs, whereas in 2024, we sent 2,611 incarcerated persons to the ER. This is an increase of 8.9% year over year. In fiscal year 25-26, it is estimated the Sheriff's Office will owe $26.9 million for off-site medical claims. The ability to manage off-site costs are difficult, as the cost is calculated and paid well after decisions to seek higher level of care has already been made in the moment when we're providing medical care. Over the course of the past 4 years, the Sheriff's Office has experienced significant change, especially in the Detention Services Bureau under the leadership of Sheriff Martinez. Sheriff Martinez is committed to improving medical service delivery in jail and custody deaths. As a result of the changes due to the enhanced level of care, intake procedures, and improvements resulting from the litigation and legislative outcomes, such as Prop 36, there have been multiple factors contributing to the rise. We currently house a population that requires higher level medical care due to chronic illness, opioid withdrawal, and undiagnosed medical conditions. The Sheriff's Office is continually evaluating its services and program delivery to find ways to offer high level of care while being fiscally responsible. An example of this is the opening of the medical wing at Paradise Valley Hospital that's dedicated to individuals under the care of the Sheriff's Office. The rate at which Paradise Valley Hospital charged the county for admissions and administrative stays are significantly lower than that of other local hospitals. Unfortunately, NAVCARE's insufficient administrative capacity and the lack of CalAIM pre-release billing capability, which must be implemented by October 1st, 2026, has caused the Sheriff's Office to explore a new direction to operate the needs that fall under medical administrative services, while maintaining a high level of custodial and medical care already in place. The Sheriff's Office is currently facing 3 significant challenges under the existing NAVCARE contract. First, NAVCARE's administrative and operational capacity is no longer sufficient to manage the increased volume and acuity of off-site hospital care. Secondly, the inability to implement CalAIM pre-release Medi-Cal billing will result in potentially missing reimbursement opportunities and compliance risk that will take effect in the future. And third, off-site medical expenditures are trending towards exceeding NAVCARE's annual $20 million fixed fiscal burden for the Sheriff's Office. I reiterate, the primary purpose of moving administrative service organization to Americhoice is to leverage the CalAIM Justice Involved State Initiative to obtain reimbursement for claims processing of pre-release services. This will help offset escalating costs for off-site services. The state's comprehensive transformation of Medi-Cal is designed to improve care coordination and expand services for vulnerable populations, which includes individuals who are justice involved. California received federal approval to offer a targeted set of reimbursable medically necessary services to incarcerated individuals during the 90 days prior to release. This is a historic exception to the federal Medicaid inmate exclusion. Historically, counties paid 100% of healthcare costs for incarcerated individuals because Medi-Cal would not reimburse services during incarceration. CalAIM changes that by enabling Medi-Cal fee-for-service reimbursement for approved 90-day pre-release services. This funding is significant because it offsets costs for care that the jails already provide. The Sheriff's Office will receive reimbursement for such things as clinical consultations, medications, diagnostic studies, and durable medical equipment. CalAIM implementation will create sustainable revenue source instead of relying solely on local funds or grants. The funding will improve continuity of care for our incarcerated population, and our hope is that this will reduce recidivism and stabilize individuals transitioning back into the community. Today's board action is critical to successfully implement the billing capability necessary for CalAIM reimbursement, which must go live by October 1st of this year. The slide above provides a fiscal overview of the Sheriff's Office Medical Services Division, dental specialty care for individuals in our custody, both on-site and off-site. The Sheriff's Office provides these services through a combination of contracted providers. Has grown more. This budget has had to support rising hospital utilization and specialty care needs. Of our $180 million medical budget, $81.5 million is dedicated specifically to contracted healthcare services. This includes on-site clinical and mental health services, specialty care, pharmacy services, and off-site hospital care. The Sheriff's Office relies heavily on contracted partners to deliver this required care, but the complexity and costs of that care are not static and can vary year to year based on patient population needs. This next slide illustrates one of the challenges, the central challenges driving today's action, the gap between NAVCARE's fixed off-site costs and the actual off-site medical expenditures. NAVCARE's contract includes a fixed allocation of $19.39 million, with a contract annual cap of $20.6 million for off-site hospital specialty care. Based on the current utilization, we are projecting an additional $7.6 million in annual costs over the cap by the end of this contract year, which is May 31st, 2026. That result in off-site costs cost is approximately, the results of total offsite cost is approximately $26.9 million. And that difference must be paid directly by the Sheriff's Office. This overcap liability is a significant driver for transitioning administrative functions to AmeriChoice. Under a cost reimbursement ASO model, the county can capture Medi-Cal reimbursement through CalPAN and reduce future exposure to unbudgeted costs. One of today's board requests is to allocate $13.8 million for the community corrections sub-account based on projected total overages, which includes both prior year and current year over the cap amounts and various contracted provider variances, which totals $17.6 million. This includes the prior year over the cap amount or overage of $8.8 million. Office to enhance contractor oversight involving billing and future reimbursement opportunities. Furthermore, AmeriChoice has an established relationship with the County of San Diego, the Sheriff's Office, as well as local hospital systems. They offer operational stability and expertise in managing complex healthcare needs for a vulnerable population, including those in custody. We seek to leverage cost efficiencies for off-site medical services as a result of AmeriChoice's ability to negotiate local hospitals, healthcare organizations, and specialty providers. And last, AmeriChoice has the infrastructure to forecast billing trends, including statisticians and auditing capabilities. To recap, the Sheriff's Office is requesting to establish appropriations for $13.8 million to the San Diego Sheriff's Office to cover previous and current overages for off-site medical and mental health services for the incarcerated population based on local revenue fund 2011 community corrections sub-account. We ask to waive board policy 887, competitive procurement, and approve and authorize the Director, Department of Purchasing and Contracting, subject to successful negotiations and a determination of fair and reasonable price, to amend the Administrative Services Organization contract with United Healthcare Services, aka AmeriChoice, managed by the Human Health Services Agency, or HHSA, to include the Sheriff's Office participation and align with existing contract terms. In accordance with Section 401, Article 13, or 23, my apologies, of the County Administrative Code, authorize the Director, Department of Purchasing and Contracting to conduct a future countywide competitive solicitation.
Okay, Chairperson McCreary.
Thank you very much, Madam Chair, and thank you both for being here and sharing this information with us. Just a couple questions relating to CalAID. You briefly mentioned what kinds of things we can now get reimbursed for, but can you walk us through the CalAID requirement for 90-day pre-release Medi-Cal enrollment and services?
There are certain medical conditions that can be reimbursed through the county. If anybody, but it could be things like treatment for hypertension, basic things as well as specialty care. So it's pretty broad.
In my understanding, it's also physical and behavioral health and addiction treatment as well. So if we don't comply with the program, which we know expires October 1st, what potential future cost overruns will we see?
I think the biggest impact is not receiving reimbursement. There's potential savings of millions of dollars a year with the engagement with CalAID and participation in CalAID. Similar counties, not quite our size, have received savings in the anywhere between $6 to $9 million, and they're not quite the same size that we are. And as far as if we don't participate in CalAID, what are the potential impacts of overages? I think we will continue to see that if we maintain the same vendor with NavCare. AmeriChoice does a great job of renegotiating hospital contracts, which give us more favorable rates, as I said in the presentation, as well as a more robust auditing component to verify the invoices that we're receiving back from the hospitals to vet the accuracy of the services rendered by those hospitals.
So you are basically saying AmeriChoice is more well equipped to ensure that we get those reimbursements from CalAIM.
Correct. Actually, we've offered NavCare the opportunity to participate in CalAIM, and initially it was written in an amended version of a contract, and they rescinded that offer. And I can refer to that in my notes if you like.
Well, I mean, I'm just interested in, you had some, you called them in your presentation, efforts to further contain costs, but what assurances can you provide that AmeriChoice will be in compliance with the requirements for CalAIM?
I believe they're a proven partner and already doing it locally with our probation department. Is that correct? Yeah, I believe they're already complying with CalAIM and other venues. So they have a history of being able to complete that little function.
Okay, thank you very much. First and foremost, I want to start with clearly real challenges within the Sheriff's Medical Services system. At this time, I'd like to offer a substitute motion for the one that's on the floor to bifurcate recommendation 1 and move forward with recommendation 2 and 3 by adding a 4th recommendation. That recommendation would include, what I asked is to have regular and public reporting back to this board on costs, including monthly offsite medical expenditures and how they compare to projections, transparent tracking of CalAIM implementation, Medi-Cal enrollment efforts, as well as cost recovery through Medi-Cal reimbursements for services to ensure we are actually capturing the revenue this model is supposed to generate, and clear performance metrics for this contract, including improvements in coordination, timeliness, and cost convenience. And lastly, an early and proactive notification to this board if costs begin to exceed expectations. I know in the presentation it was suggested that we could do that on a 6-month basis, but I think that I would feel more comfortable if we have these. Do those sound something that you?
You know, everything except for item 1, the monthly reporting, we just have to report back to this board, but if you like a data issue or capacity issue, we just haven't had that conversation, but the rest are fine. Okay.
Okay, so your amendments, your is that right?
Yes, so my amendment, my substitute motion is to add this 4th recommendation that I just mentioned. For A1 with monthly offsite medical subject to the ability of AmeriChoice. I think we'll hear back from that, but maybe we
Yeah,
get
and what other so we wouldn't be doing it.
correct. Yes, yes. And then the substitute motion also includes a request to bifurcate recommendation 1 from the rest.
So in case you want to vote separately on
Correct.
recommendation 1 and all the others.
Correct.
Can you go back to recommendation 1?
Recommendation 1 is to establish appropriation.
Yes, and I'll share my comments on that one. I can't support recommendation 1 because I don't support the use of the community corrections sub-account to backfill the $13.8 million shortfall. My belief is that funding is limited, it is restricted, and in my view should be prioritized for community-based investments. Things like reentry support, restorative programming, and services that prevent people from entering or re-entering the detention system in the first place. In District 1, which is the poorest district in the county, families are making incredibly difficult financial decisions every single day, and I don't believe that we should normalize a pattern where we continually have to have shortfalls. So it's the reason why I can support item recommendation 1. I do suggest and recommend that perhaps the sheriff can come back with some alternative.
I think I misunderstood the bifurcation. You're not moving item 1. So you
But
have,
I'm giving my justification why I can support it.
I understood. Just I want to make sure we're all clear what the motion is. So we've got a motion on the floor from Supervisor Desmond, second by Supervisor Anderson, to move the item as is. We have a motion on the floor from Vice Chair Pro Tem Aguirre that would bifurcate item 1 from the remainder of the recommendations and move, bifurcate and then move
to my colleague first to this, and we.
Thank you very much, Chair, and I want to thank the Chairperson for pulling this item. I think it's very important that it actually be discussed. It is a large amount of money, and we are going in a different route, and so I think it deserves discussion. Sheriff Martinez and staff, thank you for being here to present. I have a lot of questions too. I'm trying to get them, synthesize them, but I want to focus on the cost and the cap. So what we're being asked to do is to amend the current contract that we have with Americhoice, since they work with other departments within the county, and to add the sheriff's department and those functions to the
Yes.
Okay, and so we have a current contract with NAVCare, and it is, the term is up April 2027.
Yes.
Okay, so normally if we were going to ask for those services again, because was CalAIM, I know that CalAIM became, I guess, established through the department, the State Department of Health in 2022. That's the same time that we entered into the contract with NAVCare. At that time, were there conversations around CalAIM?
That predates my administration, I don't know.
Okay, sorry, it's okay. It's around the same year though, so I could anticipate somebody in the staff knew that this was coming. Also, just a plug, we don't know if CalAIM in different aspects of it are going to continue, because we have to go before the federal government, ask for a waiver, and we're not hopeful about that. I hope that it goes through, because I think this is very extremely important and has helped the community in a lot of different ways that we don't know. And then Sheriff Martinez, you indicated because implementation of CalAIM, the deadline is September. So there will be, provided this passes, there will not be data enough to come to us until October. Is that accurate?
That's correct, yeah.
Okay.
CalAIM implementation, we're targeting October 1st, 2026 start date, so we wouldn't be able to give you any data on enrollment for CalAIM or building services until probably November.
Okay. So, does that mean that based on this action today, when would be the kind of the first service date, or when would this amendment to the contract begin services with Americhoice if this were passed today?
May 1st would be the beginning of the Americhoice relationship, and then the discontinuation of the NAVCare contract for these services.
This can be for either of you, or it can be for our CAO. When we go out for RFP, how long of a runway do we give ourselves? Like if this were not sole source and we were just going out, which I'm just gonna tell you, that would be my preference. It's April 2027, that is a year away. Usually we have 6 to 9 months or whatever it is, especially for a contract this big, right? To put it back out, and ask and solicit those bids. How long does that process normally take for us?
Yeah.
Sorry to choose.
That's why I would say this question generally, I don't know if the specifics in terms of the history for this service that's being procured here, but I would anticipate that for a contract of this scale, in terms of the services that are being provided here, that you would need to ramp up of at least 6 months to do the procurement, have it on the street, meet with anyone who's going to be responsive to the actual solicitation, and even with selections at a minimum.
Okay, so instead of starting that process right around now, we're doing a sole source with Americhoice for another 4 years.
Well, we'd like to start the CalAIM building in October. I think that was one of the points and also stabilize costs as soon as possible. Right now, we have so many overruns with NAVCare because they don't have relationships with negotiate.
Medical eligible now, we go through the process of getting that covered. Systems at the county.
Correct. We would enroll them with either our reentry services team or through Americhoice, or whoever the outside vendor is, or NAVCare can enroll people in that account. And as soon as they hit that 90-day pre-release window, services that we've rendered to them, whether it be on-site or off-site, can be reimbursable. So that part of the billing component was complex initially for NAVCare, and And then they initially had an amendment to complete some of those building components, but they rescinded that offer because it was complex. I think it was difficult to do it from a company in Alabama as opposed to a large system that we have here in California.
Okay, I have two more, I'll try to keep it to two more, there's questions about the contract and recommendation. I know that for the, what the chair pro tem put forward, she, just wants to be moved or bifurcate, recommendation number one. But my question is, according to the way that I read it, we owe a little over 17 million to NAPCARE at this point. What was the $13 million ask? How would we, what is the plan to fill that additional $4 million?
The plan was internally to find funding with the sheriff's office budget for the additional $4 million. The 13, I believe it was 13.8, would go to cover the $17 million overages for the past 2 fiscal years.
We just don't have the capacity in our budget with all of the other expenditures that we have right now to fill the entire need.
Okay, so it's a partial ask. The cap, the $20 million cap. Is there no cap? How is the current amendment to the contract structure that you're asking for approval that would actually lower those costs? Like what? So I'm just not understanding. I've heard millions of dollars. There's no, I think my staff, I just have to ask that question. We haven't really received any concrete even projections or, you know, this many people will be enrolled and it was because of this many visits, it may result in this type of reimbursement. We never received that. So I turned into savings or what that offset would be.
Yeah, I'm gonna have Dave, who's my contract manager, to speak to the contract and stuff.
Okay.
Good afternoon, Chair and members of the board. Historically, mergers we had in prior to 2022, how they operated was more of a cost reimbursement model. We have a trust fund that's set up. So, like, for example, if we set aside about $2 million of that contract amount into a trust account, whatever emergency claims or bills that given month, let's just say $1.5 million, that excess of $500,000 will roll over to future use, as opposed to NAPCARE where it is a fixed model. We are paying 1.7 million on a monthly basis, regardless of any overruns or any overages. It goes towards that cap, the $20 million cap. We can't really, I guess, project out like how much NAPCARE is going to increase. I mean, historically, I think last contract year, I believe, was around $8.8 million. This year, based on the February invoice that we received from NAPCARE, the paid and unpaid claims that are obligated that we have to pay is around 23 already. So I know we talked about $17 million. It's like that's how much we paid already, but they're still adjudicating an excess $5 million. So those are just through a monthly basis through the end of the contract term until the cap resets again.
Okay. I do think I don't know from experience what you all do, that it is hard to project because some of what you do is very volatile. I understand that. But as we're having budget discussions today, we're having to make a lot of tough decisions, and all I ask is that I be able to it's going to save money overall. Like the numbers don't bear that out as far as what is in front of me. I understand the conversation around the cap and how that is increasing the amount from the 20 million, but we're being asked to enter a contract that annually for the next 4 years, single source for $25 million a year. And I don't see the justification in doing that. I'm happy to consider it further. This will probably pass today, so that may not be an issue. But for me, especially with the times that we're in, I really need to see what those projections look like. And no matter how much we ask, it's just really hard to read that. So at this point, I won't be able to support this item. I appreciate the share, your focus in counting and what overall what it's supposed to do. But I don't have enough in front of me to get there for this ask. I think it's a really big ask, a really big switch, about a year out from when the contract was actually in, and it's just, I won't be able to support it today.
Okay, thank you. I'm gonna ask different things to stay here. First of all, I just really wanna acknowledge and appreciate, you flagging that this structure is not working for us, for the county, and we can move to, hopefully a better structure that, would eventually save us money, and provide better care for everyone. So first of all, just like, thank you. But now that we're all here, talking about the contract, I have a bunch of questions. I think the core of my question is trying to better understand like the structure of the NAVCARE contract. It's sort of two parts. Like, what was the structure of the NAVCARE contract prior to that $20.6 million cost cap being like renewed?
That was all administration. The hope, I think, was to remove medical care, facilitating medical care in the facilities and provide and put it under one contractor. That's the model that most jail systems and sheriffs use in the state of California. Because of labor and not wanting to remove county employees from an employee, we decided to bifurcate and have a contract provider manage all of our so the county doesn't have certain classifications, X-ray technicians, doctors, things like that. So about 20 or 23 contracts were going to be managed by a provider, and then we would maintain responsibility for our sheriff's employees, with your nurses, clinicians, things like that. So we put it out to RFP. I think were given three individual companies took the bid. NAVCARE was the lowest price of those, and we brought them in. It's been a difficult adjustment for all of us, for NAVCARE included. This is not a model that's anywhere else in the country. Typically, one of these providers will take over all medical care in the facility without any the employees and the policies and things that are going on. So as we navigated this together, we identified that there's some things that NAVCARE is really good at, and some things that we would be better served, and our population would be better served if we contracted out with other providers. So that was why we went to CHP and some other models, pharmaceutical and things like that. This is another one of those instances. We really believe that AmeriChoice is a much better solution for medical billing. We think that they can stabilize costs, they can negotiate contracts better with our local hospitals and get better treatment for our population. So that's really the driver.
I'm just trying to like untangle the tangle with my brain. That there was a contract, NAVCARE won because they had the lowest cost, and then we amended the contract. So what was the structure I'm just making sure I understand. So we amended our contract to say, hey, there's now a cost cap of $20.6 million. If the cost exceeds that, then we're the cost bearer instead of NAVCARE. Correct. What prior to that, were they the cost bearer?
Correct. Yeah, that's correct. So prior to the cap, any overages that they sustained were taking money out of their profits, and I believe it was a fair ask to establish a cap to say, hey, anything after this number, the sheriff's department is going to be responsible for. And I think that, I don't know how that was projected, maybe Dave can answer how that $20 million cap was projected, but that's where the ownership of the overage changed hands, was in that event.
Got it. And obviously, if you're going to have a contract amendment where one party gets something, they have to give up something, right? Dave, correct me if I'm wrong, but things like pretty, that I know, that much I know. So what did we get in exchange, right? We obviously they got, they shifted the liability for cost overage, so what did we get and what did they give up?
So in that area, they proposed to get the insurance liability. They requested to increase that cost. I believe at the time we did, and we agreed to that cap because we saw that the liability and insurance increase that they proposed was not as favorable as the cap, but yeah.
Okay, no, that's fine. I mean, just to be clear. So what we got, we traded, we took the overage and they took more liability.
Yes, but I'd like to add that our system has changed since that amendment. So having providers during the intake process has helped us identify not only chronic issues, but acute issues early on, which has equated to more send-outs. So the cost has gone up since we established that cap because we're seeing people earlier. And I think the overall goal of looking at that in the big picture is we see a reduction in custody deaths. And I think it's because we are important to validate some of these costs because we are seeing a reduction in some of those in custody deaths.
Okay. Sorry, lots of questions. Like I said, thank you for your work on this, and now you're here. So now I feel like quite responsible to understand what's going on. So, going to your American there a cap in that too, or who's responsible for the 25 million? Who's the cost bearer?
I mean, that's why they have to reverse hospital rates. Historically, I believe they're going like 130%, 130%, like even our UCSD partners. Basically, yeah, the rates have built before and like anything over 25 million. That's the goal.
So we would no longer be the bearer of costs for overages over 20 or even 25. We're going to pay them 25, but what if costs are like 32? Who bears that cost?
That'll be something we can negotiate in the contract, certainly. And we're going to be clearly monitoring monthly what the costs look like and where they're at. And we do have, we've been a trusted partner for a long time with the county and also with us prior to 2022 contract with NAFTA.
I think what I'm struggling with is that if we're expecting, like, whoever is responsible for doing them, well, let me ask another set of questions and then I'll circle back. What is the incentive structure around the NCIP enrollment? I mean, that I think, and if we improve enrollment in Cali enrollment, is that the best avenue for cost containment, or what is it? And I think what I'm trying to understand is what is the difference between the costs that we would be incurring if we're sort of maximizing our enrollment versus if we're like doing a slipshod job. I don't mean we, I mean kind of the collective we.
Yeah, I'm going to have Chris Meyer go talk to you about that.
Good afternoon, I'm Chris Meyer, Medical Services Administrator. And the question was specifically the NCIP program and how we can leverage that is exactly that. Like right now, currently, one avenue that the state gives us to help mitigate and cost contain and share the cost of inpatient visits is the NCIP program. And right now, it's not being currently utilized to its full effect. That right now, any of the incarcerated persons require intensive service severity of illness, due to the severity of illness that requires inpatient services. We would like the hospitals to participate, as we do, that our county participates, the Sheriff's Office participates in this program. We'd be able to mitigate, share the cost of the state. So right now, we're not optimizing that with NAFCARE as our third-party member for the ASO right now. So one of the moves that we'd like to make is to have Merit Choice negotiate that participation with the healthcare organizations in the community, mainly the hospitals.
So to be clear, you feel like for some reason or another, I'm sure NAFCARE would have a different story, but for some reason or another, we're not optimizing enrollment. And your belief has to do with how NAFCARE is administering the contract. There might be other views on the part of NAFCARE as to why that might be the case. But regardless, your view is that reason or another, we're not maximizing enrollment, which is driving costs up.
That is correct.
Well, then it would seem to me that if we were to move forward with any new contract list, the core of it has their choice to take responsibility for enrollment. They also need to internalize the costs. Then there can't be like a cost cap, because then they're not incentivized to do everything they can to enroll people, because they could just shift the costs. Am I missing something?
No, I understand that. So it's a fair argument to have. I would like to make sure that we have provisions required.
Between requiring something in a contract and how do you document, how do you make sure they do it, and you monitoring issues and blah, blah, blah. It's much easier to just say, like, y'all are responsible for the cost if you don't do your job, right? There's just a simplicity in that. So I think it does speak to like how do you avoid the risk of the cost overrun. Yeah. Sorry, Sheriff Martinez. So from the Vice Chair's kind of position or point of view of like why not just do an RFP? Sounds like we probably have the mayor's choice anyway. Like, why not? I mean, I just wanted to better understand why move forward with sole source instead of say, hey world, who's the best out there?
I think we're just trying to move forward with timeliness of moving forward the project. We have so many really large monumental lifts with our medical services, and we're trying to be as efficient and careful and thorough as we can be in examining them. I think that it's important to understand how enormous and complex medical care in a carceral setting is. $180 million in medical expenses every year is something that we're navigating constantly and trying to do the best and be the best stewards for public funds. We think this is the best move forward to accomplish all the things we want to do as soon as possible and to control hospital costs as quickly as possible. It's not just about counting, it's also about controlling costs more immediately.
Okay, and you said that most of what was in the Chair Pro Tem's amendment was doable. Would you remind us what wasn't?
The first item, just because we haven't talked to our choice yet to see if they have the capacity or capability of doing monthly off-site medical expenditures piece, we will certainly have a conversation, and if they're capable of providing that to us, we can report that back as well.
So do you want to keep that in? Because that would mean that if they can't do it, then they can't sign the contract.
Well, let's at least shoot for bi-monthly.
We can do an amendment after we find out what they're capable.
Say, oh, we can't do it, then we won't have that important data point. So that there's gotta be, I think that by stating at least the timeline.
We can do our best to do it internally if they're not able to provide it. We just learned of your interest in this monthly reporting a little while ago, so we haven't had time to explore it.
Why don't we put bi-monthly and use that if there's a cost overrun after X amount, that they're responsible for it. That's part of the, one of the requirements for negotiation. Is that something you're also down?
Yeah, I think we could certainly negotiate that. My concern is that they would stop doing send-outs or hospital stays. That's one problem we've run into when it gets too expensive in these contracts. People are sent back to the. So I would like to explore that idea, but we certainly could propose it, but then we would, I would just want to pay attention to that. We've seen that in the past with the last conference.
I hear that. I mean, I think there's a lot of unknowns. I think, first of all, I think it makes a ton of sense, like, globally. Obviously, it seems like NAVCARE said, just for whatever set of reasons, maybe on their side, maybe on our side, I don't have enough information on their perspective, but somehow, not the right fit, to put it mildly. So, it does seem to make sense to kind of go with a provider who's already doing a lot of our county services and has a bigger network. And I think, sorry, I'm going to make a proposal, sorry, Sheriff Martinez, so please excuse me. I think my preference, if it would be possible, I think I support all of these who internalizes the cost, as Chris was saying, the cost internalizer. So that to me seems like the biggest question of like, if we're gonna have a $25 million contract and they're responsible for all the enrollment, then I wanna see them like responsible for the cost overruns and not us. And some, maybe some performance metrics requirements on enrollment, right? Which seems core data. Would it be possible to continue this item a month and give you time to sort of hash it out with American Choice and come back with sort of more details on like what this contract would look like?
I think prior to the contract, is that appropriate? Yes, it was. Possible.
Sorry, would you repeat that?
From the chair.
Yeah, sorry, I think I'm just a little reluctant to give, right now I feel like there's not enough information, there's a lot of unknowns on how we would structure this contract, and it seems like a big delegation of authority from the board, given that things is sideways under Sheriff Gore, previous leadership, on the NAVCARE piece. So I was wondering if we could continue this item and have come back with once we have a little bit more detail on whether some of these requests from the chair pro tem can be met, as well as my concerns about cost overruns and like internalization of externalities.
So I guess my question for you, sir, is it appropriate to have those discussions with Americhoice prior to a formal contract?
I was going to say, it depends on the information. I wouldn't want to presume that this was sort of
I think what I'd love to do is put a little bit more guide rails on what this contract would look like, but at the same time, I don't want to tie Sheriff Martinez's hands. So I think the question is, can we get a little bit more information so that we're able to put guide rails in a fiscally responsible way with, or maybe we can just put those on and say, hey, that, get there, and then come back to the board.
I think we may be able to look at other contracts in other areas and see if that's something. I'd be very open to exploring that, what that could look like. I also don't want cost overruns that I'm responsible for my budget or to have to come back to this board. And I totally appreciate that we're also in the same place. We don't like having to come before the board for cost overruns, but we also want to take care of the people in our custody and make sure they're getting the best treatment.
Well, I think I guess my preference here, and I know Spurgeon doesn't have his hand up, and Supervisor Geary would be, I want to get there on this. I think this makes a ton of sense, but I feel like there's a lot of unanswered questions that I wanted to get kind of like more clarity on, especially just because we got so far last time, and they were clearly more clever than us in calculating that cost overruns were going to be worth more to trade than liability insurance. Good deal. Kind of thinking this through and getting ahead of it. So let me just pause there. I'll tune the floor to Supervisor Does and Supervisor Geary, but I think if there's a pathway to continue this and come back with some of these questions answered, especially around contract structure, that would be my preference. Supervisor Desmond.
Thank you, Madam Chair. Appreciate it. So I guess I have a question here with this is a half a motion on the floor about just voting for these two, 3, and now 4, which seem reasonable to me. If we don't establish the appropriations of the $13.8 million, which is the first request in the recommendations, does that make everything else moot? Or is this $13.8 million, is that what it's going to take to get out of the contract with TrueCare? I'm just trying to figure out what's this $13.8 million, how, if we do this or we don't, it blows up the rest of the deal.
Yeah, thank you, Supervisor. I'm happy to answer that.
Okay.
So the $13.8 million would go towards the fund balance for medical services division. That really contributes towards the $8.8 million that's from prior year.
So this is just a backfill of what we've over.
We're already over.
We're over, and we need to pay up. And if we don't do that today, it's just going to keep growing, and getting worse. Of course, that's going to happen anyway.
Yes. So the longer we wait, it's about $2.5 million that we're projecting every month. As we say with after until the cap resets in June. So what we are projecting if we
on this 13.8, we need, the sooner we do that, the better, or it sounds like it's gonna take a month or two to get it done now. I'm just trying to figure out the urgency of item 1 if we go ahead with these other items.
All of it are cheap price.
Okay. Because I'm not really quite sure I would support this if item 1's not in there.
Yeah, it's basically gonna pay the debt we already owed to have here with the overruns. And the emeritus would, I believe, be something.
And that's gonna keep going up anyway because we're still with healthcare until.
As long as we stay with them on this particular item, the billing, outside billing, you have to have 1 month.
Okay.
Good afternoon. Currently our medical services division is over budget, so this will help. The amount that we owe after now, the 8.8 from last year and projected 7.6, it's not budgeted. So we are going over budget already.
And this would be coming out of the community corrections sub-account, is that right? So it'd be coming out of the sheriff's account anyway? Or is it coming out of, where's it coming from, I guess, specifically?
The community corrections sub-account is managed by the public safety group.
Okay.
So in conversations, determining the amount that's allowable is we took the, a certain percentage of 21%. So apply that to what would be the 81 of my population.
Okay, I guess the sooner we pay this, get this money in, the better. Is that true, or it's just going to keep accruing anyway?
We have already made some payments for last year's 8.8, so we received that later on. We received that this fiscal year. And we are projecting that we're going to owe another 7.6 million by the end of May.
So if this gets put off and comes back in whatever 30 days or something like that, I mean 13.8 is going to grow. I'm imagining, and we're still going to have to figure ourselves out of this hole one way or the other.
Correct. If we don't terminate the contract by May 31st, then we will have to amend the contract, and that's going to cost more overruns.
By May 31st of this year. Okay. So if we come back in 30 days, which is maybe early May, I don't know, maybe late April, is that going to be enough time?
Medical services has been calculating the projections, and this is based on the offsite medical.
Okay.
It's the runs for the offsite medical.
But if we put it off, we're still going to be in good shape before May 31st.
Yes, as long as we receive the funds, and as long as we terminate the contract by May 31st.
Okay.
That's our projections for the year.
All right, thank you. Just trying to figure out the urgency in that item. Yes.
Chairman McGarry?
Thank you. Just to reiterate your line of questioning, isn't it true that if we do move forward with the merit choice, theoretically we'd be having a lot more savings because of the CalAIM, and if we exit NAVCare, we won't be accruing the $2.5 million a month that potentially we could be. The bill that's outstanding is separate, correct?
Right.
It's just we need to figure out what kind of money it's going to come from within the PSG, right?
Correct.
So one doesn't preclude the other.
Okay.
So, and to your earlier point about guardrails, it is my belief that these are guardrails that are our best, would be our best effort to ensure that moving forward, we don't have a repeat of what we've experienced in NAVCare with AmeriChoice. And then if they indeed, and this is hypothetically, if we move forward in negotiations, if we approve, blah, 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 if they don't adhere to these requirements, then that's it. We don't continue with the AmeriChoice. We don't have another situation like we do with NAVCare, and then we enter into a full RFP where we would look for the best possible provider that will not incur overruns.
So is the intent, because it wasn't clear actually to me from the way forward, that these be included as requirements in the contract for AmeriChoice?
This is intended to do that, yes, to ensure that AmeriChoice doesn't fall into the patterns, past patterns that NAVCare has engaged.
Okay, sorry, it wasn't clear to me that these would be contract requirements. So if that's your intent, I think that's probably sufficient for the purposes of your amendment.
It literally says purchasing contract, but
yeah. Yeah, because they could like provide network I think my inclination, I just was going in a circle, gotta move on. I would love to make a minor amendment to Chair Pro Tem's amendment or motion, to also require that, the AmeriChoice pay, that we don't assume liability or responsibility for cost overrun.
Yeah, we work with every contract, so if we run into issues or problems, as the supervisor said,
You'll be back in a month.
I hope not.
So, that's fine, yeah, that would be great.
I'm okay with that.
Yeah, okay. Then I will second the vice chair's, the chair, motion for 2, 3, and 4. And that's not a motion on the floor. You can go ahead and vote on that substitute motion. I just, sorry.
We're still gonna have to face this 13.8 million, this overage, we still gotta face that, but we're not doing that today.
That's the motion on the floor.
Well,
I requested was to bifurcate those, so we would have to have a second vote.
Someone else, not this person.
Okay.
We're have to move, I would have to move recommendation.
Okay.
It has not been moved, correct?
okay,
So if you wanted to move it, you could, but.
I'll do that afterwards.
Well, the chairman has not moved it. Okay, thank you. Go ahead. Please vote.
Chair Lawson Merriman, that motion passes with Supervisor Montgomery Stepp, Vice Chair Montgomery Stepp voting no, all other supervisors please present.
Okay, so I'd like to make a motion to move item 1.
Okay, thank you very much. We have a motion for item 1. Do we have a second?
I'll second.
We have a second. Any comments on that? Okay, please vote.
And Chair Lawson Merriman, that motion fails with Supervisor Anderson and Supervisor Desmond voting aye, all other supervisors being present and voting no. Thank you, everyone.
And thank you all for your work and for being here and being ready to come. I think this board really is taking contracting and our oversight really seriously. I just appreciate you doing the work to make that possible. Thank you. Okay, so we are item number 18, fiscal year budget strategy presentations. Okay, that's number 2. Let's see.
Thank you so much. Good afternoon, and thank you for the opportunity to share an update on budget development for fiscal year 2026-27 and our current planning and proposed strategy. I'm joined today by the county's Chief Financial Officer, County Business Group, Deputy Chief Administrative Officers, and other members of our leadership team. In response to advice and guidance of the fiscal subcommittee, today we continue the budget conversation with you, the full board, and the public as departments develop budget recommendations for consideration. You will receive a presentation from all county business groups regarding the proposed request for the use of ongoing general purpose revenue in fiscal year 26-27. Staff will use today as an opportunity to gather feedback and insights to inform
rising costs and uncertainty at the federal and state level, the source of nearly a half of the county's revenue. These constraints require difficult decisions about how we allocate resources while maintaining core services and prioritizing resources aligned with community needs. Requests from departments for general purpose revenue exceed projected revenue at this time. Each year, the budget development process presents challenges, but this year stands out, both in the complexity of those challenges as well as the opportunities in front of us. This presentation is designed to give you the essential information you need to help and answer questions that will help guide decisions throughout the budget process. Because we know that by law, the board must adopt a balanced budget. This is a time for thoughtful decision making. As we navigate this process, we're all mindful of our value protocols and our role in continuing to support the local economy. This year's budget strategy explores recalibration strategies that support the community and advance county priorities. Before turning it over to our Chief Financial Officer, Joan Bracke, let's take a little bit more look at the detail of what we're going to cover today. We know that the county budget is much larger than just general purpose revenue, or what you'll hear us refer to today as GPR. Beyond GPR, we continue to invest in significant programs funded with revenue sources in services that residents rely on every day, such as mental and physical health support, our safety net programs, roads, libraries, parks, environmental health, technology modernization, public safety operations, and major facility maintenance. This agenda item today focuses on general purpose revenue or discretionary resources, and additional information about specific program funding services across the groups will be provided at your request. This presentation covers a foundational view of the current considerations we're weighing in building our budget strategy and the public input that helped to shape it. A review of this year's budget development process, a high-level look at proposed countywide budget considerations, a look at the priorities and proposed funding strategies that will be presented by the group deputy chief administrative officers, and some key dates and opportunities for public participation in the budget development process. And we'll close out today's presentation with time for discussion and questions. The county's work is, at its core, about people. From every program, service, and investment we make is designated to or designed to support the people and communities that we serve. From health and human services, behavioral health support, public safety, and environmental protection to parks, libraries, roads, and emergency response. In many cases, we are the region's safety net, ensuring that children, families, older adults, and vulnerable populations have access to critical support. In unincorporated areas, places that aren't within a city, the county delivers essential services like public safety, roads, and other locally provided services. Our budget is central to this mission. Each dollar we spend reflects our values, guides our priorities, and ensures resources are directed where they matter most. Developing a responsible budget that maintains county stability, protects the workforce, that delivers critical services, and strengthens our local economy is a responsibility that we take very seriously. The county exists to serve, and our current proposed budget strategy is shaped around that idea. This strategy acknowledges uncertainty related to certain safety net services posed by HR 1, which modifies key programs like CalFresh and MedCal. It maintains public safety services and acknowledges the impacts of Proposition 36, which expands penalties and supervision requirements for certain public safety offenses. Invest in the county's infrastructure, the facilities within which we operate, and the technology that we use day to day, and provide support to departments related to growth in operational expenses related to insurance, legal costs, and facilities. Across all departments, we remain committed to fairness, equity, accountability, and service. This commitment includes listening to community voices, using data to guide decisions, and investing in programs that make the greatest difference in people's lives. Every choice and consideration is made to help support a region where no person feels left behind or without recourse. As public servants, many of us feel called to this work, a calling that shapes how we approach each decision-making process. The county's annual budget is developed through a collaborative, multi-phase process. I'll turn over the presentation to the county's Chief Financial Officer, Joan Rocky, who will share more.
Thank you, Ebony. The county's budget is developed through a continuous process that relies on information from our departments and community input, as both practice and law require. This budget process is defined by the California County Budget Act. Each year, the board is required to adopt a balanced budget, meaning we can't plan to spend more than our projected available resources. As this slide shows, from January to May, our teams are actively shaping and refining proposals for the CAO recommended operational plan, which is directly informed by and overlaps with our longer-term forecasting and planning activities from the preceding months. With every budget that we plan, the county begins by assessing the current environment, the economy, community needs, county priorities, and the resources available to us. As the county team develops a budget recommendation for the board's consideration, this year our focus is on carefully recalibrating to protect county priorities, the services we provide to the region, which Emily mentioned earlier. Among the factors considered in this year's budget recalibration is the reduction in current retirement contribution rates due to the payoff of liabilities resulting from a change in retirement benefits from over 20 years ago. This reduction in retirement contributions allows us to redirect general purpose revenue to cover other expected cost increases. Several pressures are shaping this year's budget decisions. We must continue meeting the needs of all of our communities and avoid harming the local economy while also responding to broader economic pressures and ensuring long-term fiscal stability. This includes taking steps to ensure that historically underserved communities are not disproportionately burdened and ensuring continuity of support for the unincorporated areas of our region where the county is a local provider of public services. Costs are rising due to meeting changing state and federal requirements, modernizing information technology, advancing priority initiatives, responding to litigation, and managing ongoing cost pressures in public safety. Revenue growth is not keeping pace with the growth of our county enterprise. State and federal funding continues to shift, including in ways that directly affect county operations. We are also facing aging infrastructure and must maintain facilities that support county employees and the communities we serve. Each of the county's business groups has worked hard to prioritize the county's core services for the upcoming fiscal year. Group leadership will be sharing proposed approaches to improve operational efficiency through organizational restructuring, ensuring the size and scope of programs are aligned with the needs of the community, leveraging all available resources, including identifying new funding sources and maximizing the use of program revenue, and strategically pausing discretionary program growth in order to safeguard long-term stability and ensure that the county can meet the needs of our residents now and into the future. That's the landscape that we're working in. Now let's turn to something that helps guide this budget development process, the input we get from our community, the people that we serve. We consider support for the community. At the foundation of the work is our responsibility to serve people and make sure our most vulnerable neighbors are supported. We also know we can't do everything for everyone. Available funding guides our decisions to ensure a balanced budget and long-term sustainability. The board sets the county's priorities through key initiatives in response to the needs of our region. And with that direction, the teams working on the budget rely on many sources of information, including data and performance metrics to understand community needs, assess program effectiveness, and support long-term planning. Community feedback shapes budget priorities and helps improve services, which is why we continuously gather input from across the county throughout the year. This includes reviewing what we hear at public meetings like the board's budget workshop on January 27th and today's meeting, along with other upcoming events related to our budget. We still have work ahead. The strategies presented today represent significant progress. Additional strategies will be identified in order to present a balanced recommended budget, both for the upcoming budget year and future budget years to come. With that framework in mind, we will now hear from the county's business groups with an overview of how the county team is proposing to leverage countywide strategies within each group. To get us started, I'm pleased to turn it over to Dr. Elizabeth Fernandez, Deputy Chief Administrative Officer for the Health and Human Services Agency.
Thank you, Joan. The Health and Human Services Agency proposes using county GPR to sustain the core health, housing, and social service operations that we don't already receive dedicated funding for. These services support more than 1/3 of county residents. We will invest one-time GPR in protecting the safety net in light of HR 1. This includes preparing for coverage administrative costs shifting to the states and counties, along with new eligibility rules affecting both CalFresh and Medi-Cal customers. Because many details are still emerging about HR 1 changes, a one-time revenue stabilization plan is proposed to allow for more accurate analysis of potential financial impacts as it relates to state budget changes. This transition will help absorb early impacts and prevent service reductions. We're investing in ongoing GPR to support the safety net for increases in the General Relief Program, which is a program for temporary cash assistance, as well as support for projected revenue losses and refugee support services. Also proposed are investments to cover standard cost increases, such as workforce agreements, increases in fixed and variable operating costs, and contract cost of living adjustments. Lastly, we propose additional investments focused on supporting children and families. This includes increasing in foster care and adoption assistance programs, continued key investment in the Family Connection Hub and the Community Response Guide, which provides alternative resources that reflect our shift towards upstream prevention services and family support. And lastly, increases tied to recently negotiated United Domestic Workers provider wages for in-home supportive services. There are a number of other priorities that will be reflected in the budget that are funded with dedicated revenue and do not require new GPR. This includes behavioral health services and the significant system-wide changes underway. With County Behavioral Health Transition under Behavioral Health Services Act, or BHSA, all behavioral health services programs, regardless of funding source, were reviewed as part of the transition to BHSA to ensure alignment with state mandates, local priorities, and sustainable funding. This review was guided by the principles of the Triple Aim: improving access to care, improving health outcomes, and reducing costs. No new requests for ongoing GPR were received from County Behavioral Health Services for the coming year, even with the significant system-wide changes underway. Next, we'll look at our proposed budget, balancing strategies that support the safety net and vulnerable populations, while acknowledging the significant needs and overall funding requests across the enterprise. The Health and Human Services Agency will propose prioritizing of core services and operational efficiencies that allow us to improve service delivery with minimal impact to clients. This includes reducing and consolidating facilities use through a hybrid workforce model, integrating public health services with medical care services, and centralizing administrative functions. We are also proposing efficiencies by partnering with hospitals to share the cost of ventilator maintenance, reviewing and reducing our fleets, updating IT asset inventories, and streamlining records management. It also reflects the continued shift towards upstream prevention services for children and families, reducing the need for more expensive services down the road. Additionally, we are using a recalibration approach to our budget in order to better align service demands and available resources for children, families, and our aging population. This alignment strengthens our ability to continue serving as a safety net working in partnership with community-based organizations and other local resources. In addition to this approach, we will be proposing to slow hiring and in-home support services and adult protective services to align with state mandated service levels or community needs. In general, we continue to monitor service levels to ensure we remain in full compliance with legal requirements and meet the most pressing priorities of our community. We're also leveraging a state grant and Medi-Cal billing to provide community supports and enhance case management for people experiencing homelessness. I'm pleased to turn this presentation over to Kathleen Flannery, Chief Operations Officer for the Public Safety Group.
Thank you, Liz. As we prepare for fiscal year 26-27, our focus is on aligning resources for the essential public safety services while managing legislative impacts and fiscal constraints. Prop 36, passed as an unfunded mandate, continues to significantly affect our justice partners. The Sheriff's Office, Public Defender, and Probation are requesting GPR this year due to those impacts, now that we have greater clarity and better understand the resource needs. There are also other key legally required costs that we have prioritized. One area where budget pressures are especially clear is in medical care for people in our jails and juvenile facilities. Contracted medical costs are increasing each year, and both the Sheriff's Office and Probation must provide us care, which directly impacts baseline budgets. County Fire's contract with CAL FIRE also has risen due to statewide salary and benefit adjustments, and those costs must also be addressed. Similarly, increased staffing for CAL FIRE water tenders, directed by this board, also factor in our planning for GPR investment. Additionally, many public safety facilities, jails, fire and sheriff stations, youth facilities, regional centers, animal shelters, all require major maintenance to ensure their sustainability. These needs continue to drive the costs associated with ensuring safe, reliable public safety services. These on our core responsibilities, strengthening operations and making the most of every available dollar. Realigning functions in emergency services, consolidating some specialty adult supervision units in probation, reducing some services and supplies in various departments, and shifting sheriff's positions to high-need areas as we look to support frontline operations with existing resources. We're also planning to pace some program expansion requests to keep resources focused on core mandates. This includes a temporary pause on adding new staff and finding internal resources to offset some cost escalators. By adjusting the timing of these efforts, we can ensure they move forward responsibly and stay aligned with available resources. And reduce manual processes, we are modernizing operations. One example is the district attorney's upcoming upgrade of his 30-year-old case management system, 72 funds. Additionally, all public safety departments are maximizing any opportunities for grant funding, and some are focusing on developing relationships with philanthropic organizations. These decisions will help us maintain essential services while managing rising costs. With that, it's my pleasure to turn things over to Davia Lynch, Deputy Chief Administrative Officer for the Land Use and Environment Bureau.
Thank you, Kathleen. Every day, the departments in the county's land use and environment group support community well-being, public safety, and our environment. While most of our budget will continue to be funded through program revenues, such as fees for permits, a number of critical services will still depend on GPR. I'd like to highlight a few of those. One is maintaining key investments in infrastructure, like stormwater projects and major facility maintenance, that protects parks, libraries, and community spaces from costly emergency repairs. GPR will also be needed to support staffing for facilities to operate safely and serve residents, such as the new Assemblies Ray Monson Community Park that opens in winter 2026. We absorbed staffing costs for other new facilities coming online, like the Miramax Epicenter and Colorado Park this year, but we'll not be able to use a similar approach in the coming year. As you've heard from other groups, rising costs, including contracts, legal costs, IT modernization, and internal county charges, as well as mandates like those for stormwater, continue to affect day-to-day services. To support neighborhood and community health work, including environmental health and quality's role in the Tijuana River Valley through technical expertise and regional coordination. We're anticipating continuing to invest Action Plan, advancing emissions reductions efforts and planting trees to build more resilient, healthier communities. These programs form the backbone of community health, safety, and environmental stewardship that our group is responsible for. Continued GPR support ensures we meet the level of service our residents expect and deserve. The coming year's budget will require some tough but necessary decisions to ensure we can deliver a balanced budget recommendation that protects. Over the past few years, even as our costs increased, we did not reduce programs. To propose a balanced budget, we had to look more closely at what we provide and how we provide it. Using our enterprise strategies, we focused first on protecting core services, such as agriculture and food facility inspections, permit issuance, and maintaining critical infrastructure. We then identified non-mandated programs and are proposing scaling them back while maintaining positive outcomes for the community. This also allows us to propose refocusing resources on required work, like maintaining closed landfills. Additionally, we are exploring fee adjustments by shifting portions of GPR-funded programs to fee-based models and using program revenue, and will return to the board in May with updated cost recovery to help the anticipated redeployment of GPR to higher priority needs, including opening long-planned new community facilities and covering rising countywide costs. We also continue to propose investing significantly in roads and similar needs by leveraging non-county funding sources like gas tax revenues wherever possible. As we recommend these important investments, we remain thoughtful about where we recommend pacing or pausing growth to stay within our resources. We're proposing a pause in new climate action plan bike lane and sidewalk projects that have not yet entered construction. Funded projects already underway will continue. At the same time, we continue to propose funding for critical work at recommended levels, including stormwater projects and essential infrastructure maintenance. These proposed choices reflect responsible stewardship in the current environment and will be reevaluated as conditions change. We'll continue to monitor our financial outlook closely and keep the board updated as conditions evolve. Ryan Albright, Deputy Chief Administrative Officer for the Finance and General Group, will now share information about that group's strategy and prioritization.
Thank you, Abby. To support residents, local communities, and our workforce, the Finance and General Government Group is focusing on the foundational services and infrastructure to keep the county running every day. Our group will continue we plan to invest approximately $82 million in capital improvement projects, such as the Satin Boulevard hydrology infrastructure in Tijuana River Valley, the Descanso Fire Station, Heritage Park in Old Town, and planning for the Vista Detention Center. Another $82 million will go to major maintenance for things like roofs, security systems, fire alarms, and other needed repairs to county facilities. To better meet evolving needs, County General Services anticipates restructuring operations to be more efficient and agile, streamlining project management teams and reducing overhead. County Purchasing and Contracting plans to strengthen support for local small businesses and launch a new records management system to modernize information compliance countywide. Strategic investment in our elections and voter outreach systems. Ensuring fair and accessible elections is essential to community trust and civic engagement, and these resources help residents participate fully in the democratic process. Back to you, Joan.
Okay, thank you, Brian. In our enterprise support departments, strengthening technology infrastructure and modernization remains a top priority. Next year, we plan to begin implementing a new enterprise resource planning system and procuring the next IT outsourcing contract. We will also continue improving our property tax systems, including enhancements to the integrated property tax system launched at the end of last year and updates to the legacy assessment systems to reduce risks tied to aging platforms and ensure a smooth experience for property owners. We are also planning key investments in community priorities, including ongoing funding for a pollution chief to lead efforts addressing the Tijuana River Valley sewage crisis, additional staff for the Citizens Law Enforcement Review Board as their jurisdiction expands to contract healthcare providers, providers, establishing the Office of Inspector General, and adding capacity in the Office of Labor Standards and Enforcement to support enforcement of Parks Events labor standards. As we move into fiscal year 26-27 planning, the Finance and General Government Group and our enterprise support departments will rely on a range of strategies to manage rising costs, protect essential services, and support the broader county organization. Earlier, Brian highlighted how General Services has restructured its operations to reduce facility costs and better support departments. We are also strengthening efficiency across enterprise support functions by managing vacancies and finding alternative ways to do things while continuing to prioritize public-facing services and the county workforce. Departments are maximizing program revenues to offset unavoidable cost increases. For example, property tax administration revenue is anticipated to cover a significant portion of anticipated IT cost growth in our property tax systems. And finally, we will continue evaluating how we use existing resources to ensure they stay aligned with the changing operational needs as we support departments in the delivery of services to our region. I'd like to highlight next steps as this year's budget takes shape. While we gather input year-round, there are several budget-specific chances to engage. In January, at a board workshop and community input session, the board and the public provided input on priorities. That conversation continues online through a survey and dynamic priorities tool. We are also hoping to make space for additional. Instead of this, we are proposing to move the release of the fiscal year 26-27 CAO recommended operational plan from May 1st to May 18th. The additional time allows for continued input from the board and the community and for incorporating any updated information as it emerges at federal and state levels. Followed by deliberation and budget adoption. I'll now turn things back over to Ebony for closing remarks.
Thank you, Joan. As we look ahead, we remain committed to working closely with the board to navigate these challenges while protecting essential services and advancing county priorities. We're grateful for the leadership of this board and the investment of time, advice, and guidance that was provided by the fiscal subcommittee to get us here to a sustainable budget for the year ahead, and welcome comments and feedback from the full board in this early stage of the budget development. Thank you for your time. That concludes our presentation.
Thank you. If anybody has any questions, we can start with that. If not, we'll go to public comment. Seeing no request to comment, we will go to public comment.
Thank you, Chair Lawson Raymer. We have 26 requests to speak on this item, 16 in person and 10 requesting to speak by phone. Also note that we received one unusual e-comment. For any individuals that requested to speak on item 18 by phone, please dial in the conference line using the instructions that were provided to you. We'll begin with the in-person speakers. As your name is called, please come forward and stand on the arrows until it is your turn to speak at the podium. Because there are 10 or more speakers on this item, you have 1 minute to address the board. And I'll ask you to please begin by stating your name for the audio record. But we'll be calling you in groups of 3, so I'll ask you to please listen for your name. I'd like to invite forward the first 3 individuals: Loretta Kirkle, Carol Tenenbaum, and Bob Lehman. Bob Lehman, please come forward.
Good afternoon, Chair and Supervisors. My name is Loretta Kirkle, President of the San Diego Musicians Association, Local 325. And I am here to speak on the importance of investing in San Diego's union cellists. And I have performed the opera and with these kinds of jobs help our performers. We have incredible local talent here: camera operators, actors, editors, set designers, performers, and skilled crews ready to work. But too often they're forced to leave San Diego to find consistent employment. That happens with professional musicians also. Without a film commission or a coordinated film office, we lack the ability to attract and retain productions that would keep our workforce here and thriving. This is especially important for young creatives and emerging leaders who want to build careers in the place we call home.
afternoon. My name is Carol Tenenbaum. I serve as a board co-chair for the Imperial Beach Neighborhood Center. Low-income families in IB and neighboring communities have long had significant challenges to pay for basic costs of housing, transportation, healthcare, and food. And those numbers, as you know, have intensified. Last year, we served a monthly average of 678 families, with a significant rise in December that continues to climb in 2026. As food insecurity increases in our community, IB's Neighborhood Center, which is the lone food pantry in the area, is challenged to meet the needs. We know that in maintaining our food pantry and assuring access to our neighbors in need, we also serve the important function of bringing people together, strengthening social ties that contribute positively to mental health and mutual support, and restoring hope as we provide a community safety net. While seeking your assistance to meet immediate needs, we're cognizant of the fact that we're helping families today. Thank you.
As the next speaker is coming forward, I'll invite 3 additional speakers: Cesar Javier, allegedly Audra, and Michael Brando.
I'm Bob Layton, the Executive Director of San Diego Arts Matters, the region's largest arts advocacy organization focused on strengthening San Diego's creative economy. I'm here to strongly support the creation of a film commission and a film office in this year's budget, along with a competitive rebate program in the next cycle. Expanding the film industry here in San Diego County means real opportunity, good paying jobs for local writers, musicians, performers, and crew members, as well as emerging creatives graduating from our colleges and universities. Film production drives significant economic impact, supports small businesses, fills hotel rooms, activates neighborhoods, and generates spending across the region. And just importantly, it gives our local creative workforce a chance to stay here, build careers here, and afford to live here. That's why San Diego Arts Matters strongly supports the County Film Initiative. These are smart tools that will grow our economy. This is about jobs, growth, and keeping our creative talent here. Thank you.
As the next speaker is coming forward, I'll invite 3 additional speakers: Maria Elena Freeman, Gina Lee, and Mark.
You guys are funny. I would like to pass this circle jerk off, a warm handoff to Jim. You guys sit here and you perpetrate as though you are essential to public safety and that you actually care about people. You traffic children through, you're saying foster care and adoptions? No. Your child trafficking network is here with Alfredo, who went out and spoke to a mother who was traumatized, who's going to further traumatize. Elizabeth is the head of that child trafficking. Like, you are tormenting children, and we're paying for it. And you sit here and you act like you're helping them. You rip families apart, Elizabeth. You know it. Malika and Zaya Robinson are a clear example of that, and you fucking know.
My name is Maria Elena Freeman Lynn, and I think I really want to at the beginning of this. I think that's very important. I know in 2011 when I moved to San Diego, it was those resources that you guys talk about that we were lacking in was very important for my survival, safe living. And when we think about our community, we have to think, do we want to keep them in survival mode, or do we want to get them to a point where they're ready to live? Do we want to create these opportunities where there's really a case where they're not falling into the criminal justice system or the juvenile justice system? We want to reach them before they get there. I know as a young girl, I had the need, I had the support. And when I work with the juvenile hall, these little girls, these little boys, don't worry about infrastructure. They're worried about their mom's going to be able to feed themselves the next day. Or their mom's going to be able to go sell tamales the next day, then they come visit their child in juvenile hall. These needs of our community are not being heard. So I sit here and I represent them because these young children don't want to get into being into the
Good afternoon, my name is Gina Lee and I'm the Director of Staffing and Programs at Partnership for Better San Diego. We've been fortunate enough to be recipients of the community investment funds and the neighborhood reinvestment program. We have a couple of initiatives that you have helped fund. One is our food pantry and the other is our hospitality training program. In 2025, since the beginning of the year to about the summer, we saw a 260% increase in foot traffic to our food pantry. We have recipients who have told us that they never thought that they would be in the position they were in and were quite frankly embarrassed to be there. Our recipients are working families, seniors on fixed incomes. About 73% of the total households served have a minor child or a young adult in their household. So San Diego County is making a difference in these people's lives. They're literally you're feeding children and vulnerable people. Thank you.
As the next speakers, 24 non-white traditional speakers, Angela Kretschmar, Jane Hare, and Jordan Jacobo.
Mark, I mean, it isn't very much. This county is not, these supervisors are not going to help you. You guys are going to have to do your own homework. I have 55 seconds. United Nations Agenda 21 is their strategic initiative. This is what your county is really doing. This is an expert. You need to see your video. These are some times. These are YouTube video titles. This is Klaus Schwab, in case you doubt it, saying that he's infiltrated governments. Gavin Newsom is the young global leader for the World Economic Forum, the world's corporations who have no interest in you stopping them from global domination. Here's another video by Klaus Schwab. You need to see this. This will tell you a lot about Agenda 21, your future, what they're planning. Here's Larry Ellison. AI is a big help in this, coming right up to screw us all. And you can see this at 25 minutes, him at the World Summit. Climate Myths Busted, Wealth Inequality in America, another about wealth inequality. I mean,
Next speaker, please.
1 minute is not fair about this, Jeff. It's too big, you know.
Good afternoon. My name is Angela Kretschmar, and I'm the Executive Director and founder of Heaven's Windows. Heaven's Windows is a community food hub that runs a food pantry and provides child nutrition programs, providing summer and after-school meals when school is out of session. Living in San Diego is costly, making it challenging for low-income families and seniors to get by. Organizations like ours serve as a critical safety net, especially as food prices continue to climb. As nonprofits, we rely on the generosity of others, including our county government, to help us to meet the financial needs of supplying food for our community. I am here today to appeal to this board to the urgency of the need that we will not only benefit the community we serve, but be collaborative in ensuring that all of us will be fed. Today, I urge this board to recognize the critical need that exists, not just for the people of our organization.
Thank you. Next speaker, please.
Hello, my name is Jane Hare. I'm speaking today in support of the San Diego County Film Initiative, an expenditure, or rather an investment, that would support economic development and a workforce of professional creatives. San Diego had a film commission. That coordinated needs like permitting and built visibility of San Diego for national and international productions. Since the commission went away several years ago, we have watched the industry erode. Other cities and states are aggressively pursuing media production.
Alex Vasquez and Liliana Barba.
Of filmmakers, film professionals, and productions. But just because film professionals are leaving LA doesn't mean that they're looking forward to relocate to Nevada or New Mexico or Georgia. And many of them have ties to Southern California. So what better place for them to relocate than here in San Diego? I believe that this board has a rare opportunity to welcome some of those filmmakers and to assure local filmmakers that our productions are welcome here. All we're asking is that this board allows San Diego's film and media industry the opportunity to compete on a global level, and I truly believe that it will pay for itself in the long run. And I just ask that you believe that it will benefit us all in the years to come. Thank you for your time.
Hi, my name is Christine Kilner. This is my accent, I'm not doing that scared. I've worked here for 23 years. I used to work in England on big films. I worked on Gladiator for Ridley Scott. I'm with my fellow colleagues here in please having a film commission or dedicated film office.
I also run one of the largest film festivals in San Diego County. We have seen many, many filmmakers that can't make films here. We don't have a dedicated office, they don't know where to start, and there isn't one central hub where they can go and make films. And if any of you watched the Oscars this past weekend, you'll know that one battle after another, that one best film was filmed in Borrego Springs, no time Mesa. It was very hard for them to get those permits. So I'm asking you if you could please consider opening a film commission or an office, and the rewards will come back to you, I promise. Thank you very much for your time.
Good afternoon, Chair and Supervisors. My name is Liliana Barba, and I'm here on behalf of Assemblymember David Alvarez. Assemblymember Alvarez supports the allocation of discretionary funds for the creation of the San Diego County Film Initiative. This would allow our region to fully leverage state incentives and position San Diego County as a competitive destination for film and television production. Thank you. Good afternoon, Chair and Supervisor. Diego and partners with the San Diego and Imperial County Labor Council that represents over 200,000 working families and 136 affiliated unions. I am here to speak on the importance of prioritizing a countywide film initiative in the fiscal year 2026-2027 budget, as well as the importance of investing in San Diego's creative workforce. This is a workforce development opportunity, one that has infrastructure ready to scale thanks to IATSE Local 122, which has access to state and federally certified apprenticeship pathways and aligns solidarity with the workers and skilled crews that are ready to work. Of a film commission and film office in the year's budget and commit to a competitive rebate program in the next cycle. Let's invest in San Diegans. We are ready. Thank you.
Chair and Supervisors, thank you for the opportunity to speak. My name is Greg Squizers, I'm the president of IATSE Local 122, and I'm here in support of continuing forward with the full film San Diego Film Initiative. Using the county's own numbers from one battle after another, we already know what production can mean for this region. 6 weeks of filming, nearly $6.8 million in local economic impact, 250 casting crew, and 4 weeks of local stays. But we also know of at least 2 productions that did not come here last year because San Diego was not positioned to accommodate them. That is why this matters. The Film Commission, the Film Office, and Incentive Pathway are not extras. They are the structure that helps San Diego compete, support good-paying local jobs, and keeps more economic activity here at home. San Diego has already shown what it can do. Now it is time to stop leaving opportunity on the table and start building the structure to capture it. Thank you.
Thank you. We'll now hear from the individuals that requested to speak by phone. We'll start with our first caller.
Hearing the public early in the process this time. Support local small businesses, not cannabis cleanses that are expensive housing. Don't keep sucking up to the big developers. It's too expensive. My priorities. 1, police, fire, ambulance, emergency services. 2, housing, rapid housing and more housing for very lowest incomes. 3, food, housing vouchers. 4, child treatment and welfare services. No more kidnapping or abuse in the guise of protection or adoption services. The good news is that the majority of reserve transfers so far seem to be reasonable. But the unlocked reserves thing is a scam. It allows the use of reserve funds without considering the impacts it might have on the total financial picture. Of course,
my name is Kathleen Lippett. The county claims this budget will serve residents and commit to environmental sustainability, but its continued determination to grow a third predatory marijuana industry with an undisputed record of environmental destruction is in direct contrast to those goals. The continued indifference to the industry's record of harmful mental and behavioral health consequences is indefensible, and the Sheriff's Department's report, the unprecedented increase in behavioral health needs, should prompt you to rethink your efforts to maximize marijuana use among the residents you serve, as well as the residents you don't serve in the unincorporated communities. The marijuana industry does not serve community well-being or protect community safety any more than the alcohol or tobacco industries have. Thank you for letting me speak.
Thank you.
Okay, Gonzalo here, and speaking on the budgeting and the system that will stand when this one collapses, the focus will be very different. It will be rooted in healing from the inside out. Because when people are well, mentally, physically, and spiritually, we can actually solve real problems, not just manage dysfunction. Think about this. We were gifted a planet overflowing with abundance, trees, food, water, real medicine, sunshine, everything we need already here. Yet, some industry people, aka the masters of distractions, propaganda, delusions, and to further keep the masses in the dark.
My name is Angel Godinez. I'm a housing specialist for Doors of Change. I'm here to urge you to restore discretionary funding for youth homelessness programs. The young people we serve are not they are survivors of trauma. Many have never known a stable home. And right now they are facing devastating cuts to CalFresh, Medi-Cal, rental assistance, and at the very moment they need support most. This life. It is about prevention, keeping a 19-year-old from becoming a chronically homeless adult. It is about building a system that can sustain itself, not one that collapses under the weight of emergencies we fail to prevent. When we cut housing navigation, rental assistance, and supportive services, we are not saving money, we are deferring costs on the behavioral health centers, emergency rooms, jails, and shelters. These young people are watching. They want to know, will you invest in their future or abandon them at the threshold of adulthood? I urge you to vote in favor of this funding. Thank you.
Thank you.
Hey, sure, these NGO profiteers are hilarious. There's no money for a propaganda filled office when this board came to fund health care for inmates, and there's no starving children in obese America. Eliminate all funding to these fraudulent grifters and their deceptive-filled giggles. These unnecessary loan presentations are horrible as they provided zero information on what's actually being funded with our tax dollars. What even are the $3.1 million technology projects for the county communications office? Are the county business groups that envision that this board is representing corporate interests rather than we the people? Because under the progressive fraud, waste, and abuse of county tax dollars has been going for 6 years. The budget has increased again by $13.1 million, totaling over $8.6 billion while raising our reserve grade debt. If service reductions are coming because of the spell board, then the first cut considered, besides any project labor agreements or kickbacks for the campaign fund or union, defund the entire county district offices because we get nothing for our tax dollars. And for the record, Karen and Melody will ever get to know, stop wasting our time for your political. Good afternoon, Board of Supervisors. My name is Terry Ann Skelly. I attend my planning group in incorporated county and the county, and we have a lot of concerns about the needs being ignored in the budget. And instead, our money is being spent on items that have no value to us, and we never asked for these items to be in the budget. I'm a parent of young adult sons and a community volunteer who has worked in youth programs for decades. And I want our young people to be protected from the predatory tobacco and marijuana businesses. I would respectfully suggest that the budget includes funds for county code and law enforcement to protect our youth and enforce the laws around the illegal sale of flavored inhaled marijuana products. This is required by the State Department of Cannabis Control, the DCC, and AB 1207, a 2023-2024 bill. An annual county code enforcement check at a minimum is critical. It's important because the Department of Cannabis Control.
Good afternoon, Board of Supervisors. Ann Riddle here. I came to tell you that out in the unincorporated area, we'd like you to focus on young adults and our senior population. And one way you could do that is open up all our libraries instead of having them closed on Sunday. Only the very large libraries, and they're not the ones out here in the unincorporated area, are open on Sunday. We need the support that a library provides, the safe space. And if you don't know where to get the money, I suggest that we not give it to marijuana businesses. There's nothing to be gained and a lot to be lost. Healthcare for marijuana use is notoriously high. Just ask American Lung and American Heart, who've spoken out about the cardiac and respiratory problems associated with marijuana use, just like tobacco use. And let's take a look at what happens to families when marijuana use becomes prevalent. The neglect that children suffer, the high
Gambler here. You need money. You need money for our infrastructure. You need money because of Prop 13 cut down our funds. Every action you've taken now is just searching for grants. I'm offering something that could save our landfill. We have 4 to 6 years. You should be concerned about that. If you were to recycle plastic and turn it into fuel, we could generate money to go ahead and pay for the roads. We could go ahead and fix our infrastructure. We do not have to rely on bike lane grant money. We don't have to go ahead and stop people from driving. We can have stronger roads. We could do this right now. A 17-year-old African-American kid came up with this idea in high school. The fact that Congress decided to pay 2 universities to build something that does not match what
Members Iacki. I want to urge the county to move forward with a full San Diego film initiative. Bring the film industry to San Diego. We've got the talent, the local workforce, and the creation of the feedback. We also have the infrastructure, not to mention beautiful locations. I am currently working at the Oakwood Theater in Balboa Park as King Carpenter, and boy, this makes some beautiful scenery for our shows. I would love to put the same work and passion I do here in creating sets for film and television in the city of San Diego. It's always been a passion of mine, and I would rather do it here than in Los Angeles. My head carpenters and lead carpenters have both worked for the 495 in the past, and I see myself working for a San Diego film initiative in the future. That's all I have. Thank you.
Thank you, Chair Lessman, and that concludes public comment on this item.
Okay, thank you very much. Any of my colleagues have any comments, questions, in any of the groups?
No specific action was just to receive a presentation. We can continue conversations after today's meeting to just continue to solicit your feedback and advice on budget. Again, the intent was to ensure that there was an opportunity for full engagement. And again, just want to thank the fiscal subcommittee. It's been incredible. I appreciate you both for the active engagement that you had on the budget strategy development.
Okay, thank you, and thank you for coming down to speak. It's really been a priority of mine, and I think of my colleagues over the last 5 years, or at least 5 for me and less for some, but certainly to try to have much more transparency and budget input early
I'm surviving. How about you? My lungs are still processing. Should be one. Framework ad hoc subcommittee.
We're not at the 5 o'clock break. No, it's just a short. Officer. Hey, is there a notary in here? Yeah. There is? Yeah.
Not the fourth floor, right?
Well, there's a fourth.
Fourth floor, they stop at 4, or be trying to be there before 4 o'clock, so that's the way now. Pretty much. There's one on Indian Street, on Indian Street? Yeah, India. If you go straight. Oh, right. Well, I don't know if it's on that side or the right side, but you should say. Okay. And $15. Okay.
Now Monica's gone. She was here.
board established an ad hoc subcommittee on transformative reform 2024. The board then directed the CAO to perform an independent assessment of the county's information technology and telecommunications agreement. This assessment, combined with the subsequent board directive on September 30th, 2025, set the stage for today's presentation on the approach to the next IT contract review. Building on this background, today's overview focuses on the county's strategic assessment of our IT contract model. The board previously directed the CAO to elevate the county's IT strategy and contract structure. In addition to the work performed and assessments, the county staff gathered additional feedback from numerous channels to create a recommended approach to the next generation of IT&T services. We will share the key changes that will address major items noted from the inputs collected, resulting in a recommendation to the board. This approach is designed to strengthen our services model and ensure that future technology investments align with the county's strategic goals. Our recommendation today is built on diverse and comprehensive inputs. These inputs include results from an independent third-party assessment presented to the board on November 4th, 2025. The county also performed a request for information from known entities and individuals. We also collected insights from county employees through surveys and individual meetings, community engagements, and utilizing public engagement portal, labor relations partners, stakeholders, meetings, and customer surveys, feedback, and lessons learned from current and past contracts, including outside entities that have an outsourced model as well. Together, these inputs provide a holistic picture of what is working well in our technology environment and what further modernization, agility, and vendor diversity should be enhanced. Based on these inputs, the county is recommending key structural changes to strengthen the competition, enhance agility, and support improved service delivery. First, we propose splitting the current IT&T agreement into two separate contracts, one for IT services and one for network services. This will create a better competition for opportunities that allow more specialized vendor participation and provide flexibility. This is also to address the competition for cost while separating foundational infrastructure from areas that may evolve at different paces. Second, the county is requesting to introduce a new application services multi-system integrated model. This structure encourages vendor competition, supports small local business participation, and ensures project work is competitively priced while maintaining clear accountability for operational support once applications are deployed. This is to address project work and pricing. In this scenario, the county will also still have the ability to procure through the Department of Purchasing and Contracting to add another venue which can leverage the market and government rates to existing contracts like NASPO, CMAS, and more. Finally, we recommend adjusting the contract term to a 6-year base with optional 4-year and 2-year extensions. This provides necessary stability while preserving opportunity to adapt the contract structure as technology and services need to evolve, yet have enough time to settle in and operate in the new model. Collectively, these changes are designed to promote competition, enhance service continuity, optimize costs, and ensure the county technology remains secure, modern, and aligned with organizational priorities. IT outsourcing has served the county well to ensure that we are on the leading edge, eliminating technical debt, and continue to modernize as we have been. These changes are covered enhances the objective and addresses areas where improvements can be made. The fiscal year 25-26 operational plan includes $1.395 million for procurement, planning, request for proposal, and execution of the new IT contract. This funding is already budgeted and requires no change to the general fund. There will be no changes for the fiscal year 25-26, but looking ahead in 27-28, the county anticipates one-time transition costs approximately $16 million, at which the CAO will include in the recommendation to the board with exact amounts required when the costs are known, and this is just an estimated cost. Additionally, service fee adjustments are expected to take effect in mid-fiscal year 27-28 as the transition begins in January 2028, with the precise amounts to be determined once the vendor is selected. These adjustments will be incorporated into future operational plans. Overall, this financial plan supports a smooth transition to a modernized service model while maintaining fiscal stability. The recommendations before the board today are to direct the CAO to make changes
add a multi-system integrator approach, and for the application services, and have a contract duration to be a 6-year base with a 4-year and 2-year term extension. Second recommendation, we authorize the Director of Purchasing and Contracting to issue a competitive solicitation for solicitations for the new IT services provider and network services provider. This includes a 2-step approach to identify qualified vendors to request for statement of qualifications process. Second, issuing request for proposals to the qualified vendors. Upon successful negotiations, completion of an economy and efficiency and confirmation of fair and reasonable pricing, the CAO will return to the board with recommendation for award of the new information technology and telecommunications contract. These actions will position the county to maintain continuity of operations while enabling innovation, improved service delivery, and more competitive vendor ecosystem. Subject to your questions, this concludes the staff presentation.
Okay, we'll go ahead and take public comment here.
Thank you, Chair Wasserman. We have 11 requests to speak on this item, 4 in person and 7 requesting to speak by phone. Also note that we received 1 e-comment that was neutral. For any individuals that requested to speak on item 23 by phone, please dial in the conference line using the instructions that were provided to you. We'll begin with in-person speakers. As names called, please come forward. Because there's no more speakers on this item, you'll have 1 minute to address the board. Ask you to begin by stating your name for the audio record. I do invite forward. Cesar Javier, Leslie Audra, Michael Brando, and Mark.
This isn't equitable when you know that these people aren't here, they're taking up other people's time and you're silencing people. Where did the $1 billion go that you guys spent on AI last year? Or this? Where'd that go? And then we made an ad hoc committee to address the concerns about it after already allocating this money. Literally last year was 1/8 of the budget for AI. That's what was allocated. So where does that money go? Does that not seem absurd to you to even $1.35 million to just engage in a contract? You guys just throw our money away it is just, you're using it for toilet paper. It's really sad because people work very hard for it, and it's there's literally people are suffering on the streets, and we spend bullshit money on technology that is corrupted, that is programmed by people. And it hallucinates, but yeah, let's keep spending more money and using our fresh water for those data centers. Smart.
Thank you. Next speaker, please. Mark?
Okay. Thought there were 2 people ahead.
They're not here, but he called them anyway, and they take up our time.
The new information technology contracts will make implementing United Nations Agenda 21 treasonous goals for San Diego faster and easier than ever before. The World Economic Forum has infiltrated our government with young world leaders like Gavin Newsom as Klaus Schwab states in his YouTube video title. The phrase "you will own nothing and be happy" was published by the World Economic Forum and originated from a 2016 essay by Danish politician Ida Auken. See expert witness Rosa Corey's YouTube video title to understand how the United Nations is destroying our U.S. sovereignty just as they did in Europe. Mark, the new information.
Okay, people, I don't have much time here. People need to see this from 5 minutes, 28 seconds. This one, Oracle.
Thank you. We'll now hear from the individuals that requested to speak by phone. We'll start with that first caller.
all agendas and hope you can restore my time.
Come back to Paul.
Hey, Consuelo here. Yeah, I do hope you go back to Paul. And the item 23, correct? Yes. Do we really need this? I mean, staffers, this item compromises the future of you having a job. You do realize this is taking the place of real human beings. I hope you know this. And yeah. Further participation in the future of humanity's enslavement is what's taking place. And as far as the equity of the people speaking and the ones who left, the people should have 2 minutes, a minute extra, like you gave the DA earlier. So, yeah, this more have to pay attention to it because now somebody's back and Hi there, sure. That was way more than 4 minutes, Kara. Come on, you know you're just wasting time. Where's the tech to make you less robot with attitude? There's some ironic justice in having Ebony work on pushing tech that's eventually going to eliminate her job altogether. Does the IT include the $1 million AI, or was that additional spending of our tax dollars? Will this IT telecommunications contract be public like Kara's J.C. Cooper backroom deal wasn't? Speaking of which, did J.C. stand up Kara this morning? What happened to that? Will this contract also require several PRs to find out anything about it? Because obviously the so-called key stakeholders are about the people funding your political ventures. And integrated property tax system sounds like the beginning of Kara's plan of Trump Dutch program and tariff tax every resident of San Diego County to death. The extra $16 million, is there a way to not include screens for each supervisor to creepily stare at? You know how they look down at screens instead of at the living human beings in front of them? It's creepy. Monica and Jim, good on both of you for not being creepy. And for the record, nobody sent me a survey to fill out. So, no, you guys sell another one to another end. Thank you.
Thank you. I'll hear from the next one.
Sometimes it totally makes sense why you guys have your position. You don't know what you're doing. You don't know the consequences of your actions. And you keep on kicking things that you need to take care of down the road. Why? Because probably you won't be in office, right? Another person's problem. We can go ahead and pay what we want, don't what we do. You should be leading by example, but yet you don't. I don't really understand it. I mean, I'm going to have to remove the restraining order. At that point, I'm going to look into all the lawsuits that I can go ahead and bound you up and waste ungodly amount of tax money because you're going to try to fight it. I don't understand why. I would like Jim Desmond to give me a call and I can go ahead and discuss some of the possible solutions to many of the problems that we have because he is the only one that seems to want to address them. Everyone else.
Thank you. I'll hear from the next call.
Hi, Board of Beacon. I don't speak enough at County Board of Supervisors meetings. I've been living in San Diego for a few years now. I usually attend City of San Diego and Sandag meetings and occasionally San Diego County Office of Emergency Services. So, hello, happy end of March to everyone, and I just wanted to offer, you're working on technology issues with this item. It's always, I work
toward the future of more open and accountable technology practices for our community. It's an important reminder that what we talk about is the direction. I guess IT is a lot important in this item, particularly for item 23. The importance of overall tech accountability, inviting the public to the process is important. As these are IT items, I'm starting to be on a big kick that the important.
Thank you, and I'll go back to Paula Dole. Paula, you have 50 seconds remaining. I'll return to you.
Although, thanks for the time. In these business change technology, a contract for 6 years may lock us into using one provider who may be unable to acquire better technology if and when it becomes standard. You should limit the use of Wi-Fi 6 and make the contract period shorter, a year renewable for 2 years. The November report said that the county's IT services are stable, systems are reliable, and there are no recurring outages or failures, and most assets are current with 96 of hardware within support cycles, which is quite high for a county that size.
Thank you. And Chair Lostner, please call the comments inside.
Okay, we have a request to speak by Chairperson McCurry.
Thank you very much. Thank you, staff, for the presentation. I know that this is something that's very focused on driving innovation and improving cost efficiency and competition, but it's also a very, very large-scale contract that we're being asked to consider. Obviously, the amounts of money are exponential as the time goes on. So what I would like to make right now is a motion to amend one of the recommendations. I think that this merits a little bit more discussion. So I'd like to suggest that amend to have county staff return with a recommended statement of work and evaluation criteria for the overall RFP for the board's final consideration before we issue the RFP.
Do you have that written? Oh, you're on. Way ahead of me. Okay.
Just adding that we bring it back with a statement of work and evaluation criteria for the overall RFP, so that at least we have a say on those specifics of the RFP, so that we can make a more informed decision before this actually goes out into the world.
Okay. Is that a motion?
Yes. And I'll just also, I saw a letter come through from SAU, which has some interesting ideas for the contract. So I also just encourage our staff to have a discussion with the SEIU about their ideas.
Any comments or thoughts from anyone else? Anyone interested in seconding the motion?
I can go ahead and second. I want to thank you for your work. I know, thank you for getting back to my staff. Quite a bit of questions around the competitive pricing, network related cost savings, and some of those phrases that were in the April 8th, 2025 board letter that we passed. And so I will keep most of these comments from when it does come back, but that is where our head is at, and also the IT part and the telecommunications part, sort of how we're splitting that up. Those will be part of what I'll be looking at when it comes back if this passes. So thank you very much.
We have a motion on the floor in a second. Please go.
Chair Lostner, that motion passes unanimously with all supervisors.
Okay, we'll move on to item 24. And my
federal source of funding for affordable housing, but represents only a portion of the county's overall investment in housing programs. In recent years, these funds have specifically supported housing efforts across the homeless to house continuum and play a critical role in advancing the county's Housing for All initiative. Last year, funded programs support more than 70,000 county residents. The recommended projects in the annual plan presented to you today are based on extensive community engagement, identified needs, board priorities, program requirements, and the goals outlined in our 5-year consolidated plan. To share more about the plan, I am joined today by David Estrella, Director, and Kelly Salmons, Deputy Director of Housing and Community Development Services, or HCDS. David?
Thank you, Dr. Hernandez. As mentioned, the county's 4 federal entitlement grants provide essential funding for affordable housing, community development, and related services. Together, they provide approximately $14 million each year. Before reviewing the programs, I'd like to note that the funding recommendations presented to you today are based on historical funding levels, which are expected to continue. However, HUD has not yet announced actual allocations for the upcoming year. Adjustments will be made as needed once the final allocations are available. To help frame today's recommendations, it's important to understand that each program has a distinct mission. Supports communities by addressing local housing and community development needs. The Home Investment Partnerships Program, or HOME program, funds the development of affordable housing, first-time homebuyer opportunities, and rental assistance to lower-income households. The Emergency Solutions Grant, or ESG program, provides direct services to persons experiencing homelessness or at risk of experiencing homelessness. And lastly, the Housing Opportunities for Persons with HIV/AIDS, or HOPWA program, provides housing and supportive services to persons living with HIV/AIDS and their families. I will now pass it to Kelly to talk more about this year's plan.
Thank you, David. Each HUD entitlement program is managed according to its funding source and the geographical area that it serves. For the CDBG and PSG program, the county oversees funding for the urban county, which includes the unincorporated area of the county and 6 participating cities: Coronado, Del Mar, Imperial Beach, Lemon Grove, Poway, and Solana Beach. The Home Consortium includes Carlsbad, Encinitas, La Mesa, San Marcos, Santee, and Vista, and the HOPWA program, which serves the entire San Diego region. To administer HUD entitlement funds, HCDS develops a consolidated plan every 5 years. The consolidated plan describes the community needs and establishes goals to address these needs through HUD funding. Each year within the 5-year consolidated plan, 3 key documents and processes are completed: the annual plan strategy, the annual plan, and the Consolidated Annual Performance and Evaluation Report, or CAPER. Today's hearing provides an opportunity to receive public comment on the second stage. Fiscal year was guided by the priorities identified in the annual plan strategy, which was adopted by the board on November 4th, 2025. As mentioned, HCDS administers 4 entitlement programs, including the CDBG program. We receive approximately $4 million in CDBG funds each year. Based on feedback from the public and the board, the recommended CDBG projects for fiscal year 26-27 are focused primarily on affordable housing and related service investments. For the upcoming fiscal year, 14 total projects are being recommended for funding, including an affordable housing acquisition or preservation project supported through a notice of unavailability or NOFA that will be released this year for the first time using CDBG funds. The home repair program, which provides funding for health and safety repairs and allows seniors to age in place. Other projects include homeless services, ADA improvements, and fair housing services. The home program provides funding to support affordable housing opportunities for lower-income households in the home consortium area. Home planning is anticipated at $2.8 million. It is recommended this funding be utilized to further the development of affordable housing and to sustain the county's first-time home buyer or down payment and closing costs. The county also receives approximately $370,000 in emergency solutions grant funding. ESG provides direct services to persons who are experiencing homelessness or at risk of experiencing homelessness within the urban county. 2 projects are recommended for continued funding for vital services including battery housing and emergency shelter. Finally, the HOPA program provides housing and housing-related services for individuals and families living with HIV/AIDS. The County of San Diego receives an allocation of approximately $6.4 million and serves the entire San Diego region. HOPA is a critical piece of the county's Getting to Zero implementation plan, as without adequate housing, one cannot achieve health. This funding will support 10 projects, including tenant-based rental assistance, supportive services, permanent housing operations, and short-term rental mortgage and utility assistance to individuals and their families. The participation and engagement of residents and community stakeholders is an essential component of developing each annual plan. While engagement occurs through strategies. This includes multiple in-person and virtual community input sessions and an online survey. Feedback from the annual plan strategy process is used to inform the annual plan development. In total, 214 residents participated between the input session and the survey, with over 900 open-ended qualitative responses gathered from the survey. Engagement continues through the public comment period and today's public hearing. These opportunities give the community a chance to review and respond to the proposed draft plan. The draft fiscal year 26-27 annual plan has been available for public comment since February 20th and was announced in 7 local newspapers, various languages and focus populations, shared through HCDS distribution lists that include over 13,000 residents, sponsor groups, and CBOs, posted on the HCDS website, and shared through the Engaged San Diego County website and social media platforms, resulting in over 16,000 impressions. Today's hearing serves as the conclusion of the public comment period. Today's requested actions are to receive public testimony and approve the fiscal year 26-27 annual plan and corresponding resolution, approve the reallocation of program funding as necessary, authorize actions necessary to execute contracts and award funding, authorize adjustments to funding to reflect any changes from HUD as needed, and finally authorize HCDS to apply for additional funding opportunities as necessary. This concludes our presentation, and we're available for questions.
Okay, we'll do public comment. Thank you, Chair Lester. We have 11 requests to speak on this item. 1 person and 7 requesting to speak by phone. Also note that we received 1 e-comment in opposition. For any individuals that requested to speak on item 24 by phone, please dial in the conference line using the instructions that are provided to you. We'll begin with the in-person speakers. As the name is called, please come forward and stand on the arrows. Because there are 10 more speakers on the side, we have 1 minute to address the board. Pledge to invite forward. Pledge to be Audra, Speaker Javier, Mark, and Michael Rando.
Literally, there's not 11 people here, and we're going to play this game. You guys don't want to hear from the people. And I have a really hard time when you have people who traffic children here telling us that they're going to help the homeless. That is a very significant problem. When you go out in the streets, do you guys ever go talk to the homeless people? Did you do that when we were doing the point in time count? Did you go ask them if they're actually getting help? You guys should not get any more money because with the amount of money that you get, Tara, you guys should be, there shouldn't be any homeless. But it's a business, and that's the problem is that you guys literally exploit people, any living creature, to make money off of them. And they suffer at the cost of that. And it's absurd. It's like we literally have child traffickers here talking about putting people in houses. And you guys are like, oh my gosh, can't believe she's saying that. Then don't do it. Don't do it. And I won't fucking say it. But you guys want to ignore it and act like there's no elephant in the room. I mean, shit. I mean, talk about getting pissed off and wonder why.
Next speaker, thank you.
City Senior Housing in Claremont starts at $1,447 for a studio apartment. The square footage of a 2-bedroom apartment ranges from 363 to 530. A subsidiary of City Community Capital focused on affordable housing development. They're involved in various projects, including the Midway Rising Initiative and affordable housing in the Claremont community and at San Diego State University. City Community Capital is a subsidiary in affordable housing in 2024. In the tax year 2024, City Community Capital reported a net income of $12.7 billion, which is a significant increase from the previous year. If your budget prioritizes making a huge profit for City Community Capital, you are succeeding. If supervisors are supposed to spend our tax dollars wisely with no bank interest or investor profit, you fail completely.
Scam, total scam.
Now here's the individuals that request to speak by phone. Start with the first caller.
Paul Lowe, table AB 55-1 in the appendix shows how little HHSA housing cares about homeless and special needs people. No homeless to be supported and only 170 special needs people. Table AB 20.01 mentions homeless shelters and services in the urban county only. That is outrageous. The homeless are everywhere. Facilities for them should be everywhere as well. Then it seems like the department is only required to report on its progress annually, not more often. Doesn't look like they're meeting their goals, a good case for audit and a reorganization. Let me suggest building cheaper housing, which is quicker to build. 3D printed or tiny homes.
Thank you. Now here for the next caller.
Okay, Gwen Swallow here, item 24. So, how does this play a critical role? There's still so many homeless people living and dying on the streets. In every government agency meeting, including this one that I listen in on, they keep saying how they're tackling the housing issue. Different story. So which people are being helped? Because I'm always speaking to people who are searching for help through the county, and they're almost always rerouted to another agency. And this is the norm. You know, people get fatigued trying to get help, and they just give up. So this is a truly fucked up, foul system, and screwing the people is lucrative, evidently. So this is what we got, and this is where we're at. Wake up, humanity. Wake up, San Diego County. It's gonna get rough.
Thank you. Next caller.
Hey, sure, guess what? I didn't get the survey either. I occasionally read newspapers and I still never saw this plan. The presentation said 13,000 people out of 3.3 million residents were reached. That's only 0.003% of the population. What was the budget on public outreach? There's still not even transparency in the county spending on homelessness when Jim asked for it months and months ago. Wasn't it last year? This is the agency that has a full-blown corruption scandal going on with the Heart Reinsurrection Coalition that it continues to keep trying to cover up with its tired old line, attorney-client privilege. What are the consumer protections for these tax dollars? Because nobody buys any more county into a money laundering scheme with a single tax dollar. And CDBG bucks, Papa Washington, ESG greenbacks, or home partnerships paying. We must consider this a future $23 million bracket fraud until proven otherwise. Because you guys operate with zero evidence for multi-million-dollar programs. Trump to withhold all funding. And what was that about SEIOU, Mama? Don't you still owe them campaign debt? Did you pay that yet? Are you still begging?
Thank you. Here's the final caller.
That's 6 people, not 11.
You know we don't really have a housing problem. We really don't. We have a contracting problem. And you're trying to figure out ways to go ahead and fix the roads that you cannot afford to fix. You're trying to go ahead and create, I mean, you don't create the problems. You allow your NGOs to go ahead and do it. You funnel money through them so that you can go ahead and fix part of the infrastructure. I'm telling you right now, if you go ahead and invest in Julian Brown technology, a young African-American kid who came up with it, we could go ahead and start getting onto the right track. We could go ahead and fix our roads. The money generated could go, we don't have to contract it out. The problem is you guys keep on contracting it out and they're trying to make profit. And they're making profit off of us. I'm asking you to reverse Larry prior years and start doing the right thing.
Thank you. Chair Rossmarin, I'd like to move this public comment.
Question on the staff. Thank you so very much for the presentation. And this, I believe, will be the final year before this is actually called our annual plan. Okay. All right. But it's important. You have to follow what that tells us. So yes, thank you very much for it. And also thank you for the additional support for Calavo Park. We continue support for the Regional Task Force on Homelessness and Homeless Outreach and Tenant-Based Assistance Programs, and the Home Repair Program. So appreciate all of that. I will move the item with staff recommendation. Thank you.
Okay. Madam Chair, thank you for all your work, extensive work on these programs and getting those funds down here where we need them in the areas that we need them the most. One area I'd like to highlight is the City of Impro Beach Fire Vehicle Purchase and Related Equipment Project in my district, which strengthens public safety by ensuring first responders have the tools they need to respond quickly and effectively in the service of our communities. In addition to all the other wonderful housing and homeless prevention investments we make here in the county. With that all, I'm happy to second the item. Thank you.
Okay, we have a motion and a second. Seeing no other requests for comments, we vote.
Chair Rossmarin, the motion passes unanimously with all supervisors who are present voting aye.
Okay, we'll now move on to the Mayor College.
Thank you, Chair Rossmarin. We have 8 remaining requests to speak on matters not listed on the agenda. 3 individuals in person and 5 requesting to speak by phone. Those that request to speak by phone, please dial the conference line using the instructions provided to you. We have any in-person speakers. I'd like to report Cesar Javier, Billy Robinson, and Mark. And just confirm, Audrey, you want to speak tomorrow?
Yeah. You were going to let me speak right now? If I wanted to.
You signed up to speak today.
I know, but if I usually postpone it, you won't let me, so I'll wait for tomorrow.
Audrey, you can choose today or tomorrow. What's your choice?
I'm going to choose tomorrow. Thank you. I just usually, you don't give me that
Final
option.
call for Cesar Javier,
Mark.
Robinson, or Mark.
Mark may want to come, period.
I'm here.
Mark, you'll have 2 minutes to address the board.
Oh, thank you. That's a nice change.
While companies still need our labor, now is our last chance for public opinion or voting to matter at all. Once the government's gross domestic product is almost entirely produced by AI, people will be useless and there will be no incentive to support you. In fact, you will be a liability to their slave system. It is being used to manipulate and control us and will be almost impossible to escape if we the people allow this. It takes an incredible amount of power to run. AI will be given water and resources instead of we the people. Our needs are insignificant to the elite who are in the final stages of a global slave government where your every move is now being monitored. State governments have already been forbidden by Trump to restrict AI. The camera systems have already been installed, and they have prepared a digital currency the government will control, in much the same way Trudeau controlled the protesting truckers' bank accounts. Trump's friend Larry Ellison's corporation, Oracle, your data with everything you do on one digital ID to monitor and control us worse than George Orwell's book 1984, and these supervisors are not going to do a thing to stop it. They will just give themselves a raise. It's up to you to talk with everyone and peacefully stop this. At 25 minutes in this YouTube video, Larry Ellison, the owner of Oracle, speaks to the world leaders at the World Government Summit.
Okay, so I have very little time here, so I'm going to hold up some videos for you. These are YouTube video titles. This is the Larry Ellison one at 25 minutes. See him talk at the World Summit about having all your information on his Oracle system for governments, selling his system to different governments. See these video titles? I have very little time. All on YouTube. Some of them are very short, very important.
Oh, okay. Let's see, we'll be back in 45 minutes.
Huh?
I'll leave you in 45 minutes.
Okay.
Yeah.
Thank you. Now, here are the individuals that requested to speak by phone. Start with the first call.
Hey, it's the highest ranking Latina public speaker troops. On March 20th, the member and Becky no-showed their anti-Trump political theater show at Very Elementary in Esther, yet I saw a county van make its exit. Turns out Manuela ran like a coward, far away from Mexico to the San Isidro. What is surprising is next time she runs even further to South Park because she's feared in Vero Beach. February 2nd, 2025 email sent the party goer, Monica's buddy Sean Rivera, from the Communist Working Families Party, quote, "Hey, Sean, Loma Gede is joining two other WSC and North supervisors, our first California Working Families Party majority. If we want elected officials like Dora Mondani and Aguirre, we need resources," end quote. That's right, Manuel and Mondani are the same communist puppets. Another communist terrorist who visited the part-time lover bar in North Park, allegedly trying to use her county ideas gaining leverage. Still single bundler Tara apparently is a nerd at heart who reads the Atlantic and gets a thrill debating communist ideas and putting boring projects into action while 6 months pregnant and lacking a calm daddy in the picture. Nobody's business, but one can't help but wonder if Tara is promiscuous, used a donor, or is actually a straight woman in denial. But, just like Nathan Fletcher, we all know this will serve as Tara's excuse to somebody with Helen Worley and now JC. Wait, Tara, is JC single? At the March 4th meeting, Clark Ryan refused to take my comments by phone, despite me being forced in the queue. So for the record, I was against item 5. Cost of living to benefit greedy corporate developers like Alonzo Gonzalez and Joel Anderson. And at the March 3rd meeting with the County Council, David Brown made an unneeded attorney-client privilege statement on the declaration Helen Robbins-Myers told the Superior Court. I didn't even read out his email to the county jurors. Because of county full corruption, I'll cover the harm reintroduction scandal at another time. For now, an independent audit is too little too late, because the worst offender in the case is the county itself. Sickening. And all Manuel and Joel care about is eating. Disgusting. Thank you.
Thank you. And Chair Lawson, that concludes requests for non-agenda public communication at this session.
Oh. Okay, how many requests for closed session comment?
10 requests to speak in closed session.
Okay, we'll push through that, and then we'll have that break before.
Chair Lawson, item 30 on today's session, general legislative session agenda, as well as item 1 on the Fire Protection District agenda, includes 8 matters for closed session. Individuals that have requested to speak in closed session matters must provide comments related to the matters listed in the closed session item, otherwise your comments will be considered off topic. We have 10 requests to speak, 4 in person, and 6 requesting to speak by phone. For those that requested to speak by phone, please dial into the conference line using the instructions that were provided to you. We'll begin with the in-person speakers. I'd like to invite forward Cesar Javier,
Doesn't matter what you have on closed session, when you have Damon here who has people that work below him, like people like Jessica Feldman and all your county councils that go into the courts with the children and put false information into the record and literally go against their oath and try and silence people from speaking out. That is a significant issue when you guys are sitting here and trying to determine what is legal and what isn't, when you're engaged in crimes yourself. And you know it, and that's why you're looking down. Because if I was being presented with something that wasn't true, I would look you straight in the eye and say, fuck that. But you guys know it's true. You know it. You think it's funny. You think it's funny to traffic children and do that? Do you? What if it was your fucking child? Would it matter then? Probably. Exactly. Exactly. Get behind me, Satan.
Mark, would you like to speak in closed session matters?
Yes, I would. Tell me right now.
with his idea of getting rid of single-family homes and pushing people into multi-family homes. And in his letter, he actually stated, wildfire resilience must become a more consistent part of land use and development decisions. However, our housing needs, and for him, he wanted the money and attention and the policy to focus on multi-family.
I'm running out of time. You guys need to see this video on YouTube. Here's the title. It's a total scam.
Thank you. Now we hear from the individuals that requested to speak by phone. So,
Clements versus County. If he realized that the county rips up its own workers as well as most of us, South Mount versus County. County storm drains go under the driveway and broke, causing living on his property, costing about $650,000. So just fix it. LA versus County, wrongful death, car crash, simple facts that are settled. Litigation or childhood sexual assault claims. The adults who did or doing this need to be fired and the case is settled. However many there are, I don't know. TC versus County. If the site is correct, another believable child abuse case that are settled. County versus American Source Bird and Drug Company.
thank you. Now hear the next call.
Okay, Gonzalo here. So, okay. What the county is facing, current and future. When you look around, the liabilities everywhere. We're talking about a system that continues to fail. The very people it's supposed to serve and protect, like Arabella McCormick, beaten and starved and murdered. Delilah starved to death at 3 months by her unfit adopted parents. Andrea Ebbing, her and her situation and her tortured kids taken. Evelyn Lopez, people and animals in the county. It's horrible. And that alone is disgusting. Let's see, what else do I have here? People I said that are constantly being rerouted, delayed, or left out with any support. The creators, that I just again, Case A, James R. Clemens, Berkeley County. Reminder, you can't be pro-illegal immigration and pro-workers. Case B is Aaron and Terry Savanoa, Berkeley County, a family involved while suing over 2 sinkholes chewing away at their driveway. The alleged was the county rushed and split stormwater pipes that keep causing the $650,000 damage. Looking at the evidence, the road pipes from the county of portions that carried water into private property, which led to the damage. I believe that the county is at least partly guilty and should pay some damages and offer to help this family reroute the pipes further away from their property. Case B is initiation of litigation. More suing DHS for doing their job because they have 0 jurisdiction over. Will Joel vote yes again to frivolous lawsuits like he did last time in lockstep with aggressors as always? And case E is childhood and sexual assault claims. The sexual assault of children under the progressive dictatorship for the last 6 years is the progressive legacy. Own it. During the Untruth Forum about who you really care about.
I have something for non-public comment that you guys skipped me. Information. How much money have you lost? The county has lost trying to silence me. It's not working. I'm going to jump through your hoops. Then I'm going to be looking at prosecution to go up against you. You guys go ahead and spend as much money as humanly possible, but I can go ahead and pull data at that point. You know that and I know that. I can also go ahead and figure out why you haven't been even addressing Julia Brown technology when we have an overflowing landfill, where we can go ahead and recycle plastic. I'm going to go ahead and find out all of these things. Why? Because you're assholes. I'm trying to work with you. You want to be fucking cunts, and I'm done with it. I am flat out done with it, and if you want to treat me like shit, then I'm going to treat you like shit.
Thank you, Chair Wasserman. That concludes requests for public comment in the closed session.
Okay, thank you all very much. The number of items we did not get to today. I think the first one on our agenda, numerically tomorrow, is that cemetery workers, number 22. Not 9 o'clock time certain, but just we're looking to. Oh yeah. So tomorrow we're going to start with item 26, which is our time certain update. Our basic report of and then we'll have the items that are related to that presentation on SafetyNet, which is the return back and options for staff within the SafetyNet Bridge program, which was originally a item. And then we also will have continuing care update. So those are items that are related, but we'll start with the next item. This is in response to people came and presented to our subcommittee, and yes, most important things to know for everyone's self is we will start with 27 and 28 because those are related, and then after that we will roll into whatever is left over from today. 25. So we will have actually we'll start with 22. And 29. And then we have land use. And if we have to, if we don't get through land use by the time that our council has convened folks for closed session, we'll take a quick break, go to closed session for topics that are related. So, not only efficient tomorrow, it would be very good
Board is in recess until 6 p.m.
We're going to finish today's agenda before we start.
Oh, yeah.
I know you're here at the media, but these first 3 rows will be reserved for sheriff's staff, so.
Oh, yeah, no, I'm just saying, I'll get it.
That's why I say you're media, no way.
Where would be the right place to put it?
Media, right here, thing right here.
Oh, yeah. Do I need to move? Because this is not going to work.
Again, there's no, you can't, if you're taking pictures, you have to be up front, you cannot be past the podium, you can't be on that side. You could be in the back, but you have to be seated, we don't have to let people stand. Unless you're gonna be up here taking photos. Okay, so. You can move from seat to seat to seat if you want. Class is always allowed to take pictures, but you can't just walk around the floor down there. You don't allow that.
Okay.
Okay. For the board. You start right there. Yep, you're there. Right here. This is where it could be. Number 1, so this could be. This is not a. That's why they have the 1 fee. All the fees are supposed to go into that.
You guys are going to have to move back that way.
Okay.
Okay.
Yes, you will be.
Do you want to put things in? Yeah. Yes.
That way you're not carrying.
Yeah.
I'll take the water. Do you want to take the water?
Okay. Yeah, because you might be drinking it.
I was like,
Thank you.
I had heard a couple, but yeah, I guess I was that many then.
Are you able to get your view?
Yeah, I'm good. I got my little slide.
Okay.
I have a camera too, but I'll just pull that out real quick and put it away probably.
Yeah. Might be better.
I'm from a very small outlet, so we wear a lot of hats. We're not a TV station. It's a giant contraption. So you give this to all the TV stations?
Nope.
No.
Nope. Just Fox and KSI.
Fox and KSI. Okay, because he said it was 1 feed for everybody.
That's when they have a pool.
That's only when we have a pool.
But there's no pool today. So everybody's going to be squished in here?
Yeah.
If anybody
Which doesn't make
shows up.
sense.
Cool. Okay.
And it's first come, first served.
Mm-hmm. Cool. I'm glad I got here on it. been a minute since I've been in here. Yeah, I usually.
I mean, if you can push that up, if she allows you to push that up, then you guys will probably have more room.
Whose is this?
The lady with the red hair.
Oh, okay. I thought it was yours for some reason because you were behind it. I was like,
oh no,
maybe that's the official something something.
They're doing it up there. So it's already like going, it's connected to like the turn
We'll figure it out.
Like if we're actually like good in terms of that.
you work for 5 as well.
No. Work with Cal Matters.
Yeah, and I'm not. I feel like
A little nervous is we wanted 2 hours.
yeah, no, we were right.
You can tell her social media is the direction my phone. That's where everyone is now. It is. I'll get some horror. You're ahead of the times. No, you're with the times. We're trying to be. Yeah. Trying to keep up with these young people.
Alice, you guys can see those that area preserved.
It's like I write an article and then I take the same article and put it on Instagram slides and like 10 times more people read it on Instagram than they do like on the website. Yeah, people just don't go on websites anymore. Nope. Same word. On Instagram. Read it. No.
It's like 5. Well, before that, I'm lying.
Oh, we just tough day. Yeah.
Wait, we've been in the
No, nothing. Just no. The usual daily grind. No. 0%. You know what I do miss though? Income stability.
There you go. I just have to think of that. That'll get me through this assignment.
Girl, I miss that.
Yeah.
He's my partner.
He told me he was.
Thank you for that reminder.
Do what I can.
Oh, you want to use the public?
Oh, in the projects? Yeah, I'll go to
Okay, he's going to be to your left.
That's the most nasty power bank I think I've ever seen. Yeah, we're ready. What is that guy? Yes. Trying to look official.
You are official.
Kind of.
Nowadays they can't tell the difference. That was a journalist now. Apparently.
Yeah.
Sheriff's staff.
Can you open it up? See if I have it. No, I'm sorry. I'm gonna let you borrow mine. It's not that serious. Yeah. Some of my photos with the phone. I'm gonna go back to the camera, but I decided that as I was walking out the door, not like early in the day when I did it to prepare the camera. So it's my fault. That happens to me, but usually with like an SD card, which is no.
At least it's on something that's like less safe. Yeah. Yeah. Camera photo. So now I do. I don't know if you saw my border report that came out on one day about the taco museum.
No, I didn't see it.
But I needed a break from heavy things, so I wrote about Tijuana Taco Museum.
Oh, nice.
Yeah. And it was very fun. And I took photos, but I took it with my like crappy Tijuana phone that I got for like $200, and with cameras, like a phone that you pay $200 for. So the pictures were okay. they just, some of them came out a little buggy.
Why do you use a different phone?
I don't cross the border with my phone. I don't trust smart as a journalist. I don't trust crossing the border with your phone anymore. So I went to Tijuana. I bought a phone from Telcel. You can pay as you go on the data.
Oh, cool.
So then I just, when I'm going to use that phone, I put data on it and then I go. I paid like $15 to use that phone in Ireland for like 10 days.
That's smart though, because they were charging for that.
It was cheaper too. Like my phone charges like $5 a day when I use it in Mexico. I pay like $3 and I get enough data for a week in Mexico.
What are you talking about? These are good.
They're okay. Some of them did. They used the ones that came out better. Some of them didn't come out as well.
Believe me, I've seen.
So you're good with house audio?
Yes, thank you.
I've seen a lot of it.
You guys put in a really good system. It's really good.
This is really good.
What did they? I didn't even see what they put at the top.
This one. That one's good.
Yeah. That's a picture of a video.
This one's good too.
I like it.
Yeah. And this is good too. Yeah. I'm not saying this is bad at all. Like, literally, I've seen.
I did my best.
Like people take photos with their phones to us.
No, I mean, it's just the phone wasn't doing well with the lighting, and I felt like if I had an actual camera, I would like. Cause I took a picture of this family playing in a ball pit, but it was low lighting and it came out grainy, which is why I don't think that one ended up in the story.
Yeah.
But it was like the one with people in it, you know, everything.
I get it.
And I was like, it's grainy. Dang it.
And sometimes you can't, especially with like low light. Sometimes you can't control it. Even when you have like a nice camera, it's just so dark.
I think there was enough light to where if I'd had a camera, I would have been fine. Yeah. I think it was just a crappy phone.
But you did really good.
Thank you. I tried. I took up one photojournalism class in grad school. So that, that gets me through these moments.
You can take a break if you want to come back at 6:45.
Oh, you're good.
Oh, you've been around down there, you know, in bigs, riding the bike and stuff. I did that once and I was sweating and it was like all wet. Never again. I know.
Can we get a few? No, I saw it at the rate. And I don't know the real story, so I'm just trying to.
I rarely see her anywhere else, so.
How about you?
Probably somewhere, sometime in the meeting.
Take a picture. Right?
So what time should I come back?
Right now?
No.
Too blatant.
Yeah. Right now, they're still planning in. So she sees me taking photos from my mom. So we'll wait until things settle down.
Fair.
You're welcome to. That's just the way that I'm like.
No. You're the photo expert, man. I'm just here. I'm just here.
Oh, so you want something like that?
Do a little daylight social something vibes.
I was gonna move in. I was like, yeah, but you can't see this. We're like, so I can't.
Yeah, someone should talk for Adrian. Where did he go? Adrian, oh, no, he's over there sitting in the corner. Yeah, maybe he's just going to take pictures from me.
No, just.
Yeah, that's it. I always get so paranoid posting.
Oh, you're doing it like that?
Yeah.
Thank you. Good evening. We now reconvene for item 17, Truth Act Committee Forum regarding immigration and customs enforcement access to individuals during 2025. First, we just like to welcome everyone for this important forum. It's an opportunity for St. Louis County residents to participate, advocate, and address the board and the sheriff about transparency regarding engagement between the county of San Diego Sheriff and the Immigration and Customs Enforcement Agency, ICE. So there's not a lot of guidance from the state regarding the structure of these kinds of meetings, just that we have to have them. So let me explain to everyone how this is going to work today. For community forums, we'll have the following process. First, Sheriff we requested that any community member have questions, that they could submit those prior to this meeting for the sheriff to answer. The clerk will be Martinez and our team will answer these questions. And those questions, there were lots and lots submitted. We will not have time to go through all of them. It'll be 30 minutes of community questions, so those will be selected at random. In this cup, I will draw them. And then after that, we'll invite the public comments, and then finally, supervisors and the guys will have the opportunity to ask any questions of Sheriff Martinez. So I now hand the floor to Sheriff Kelly Martinez for a 10-minute presentation. Thanks.
Thank you, Chair Lesser and members of the board. The Sheriff's Office falls within the reporting requirements of the Truth Act, given our role transferring individuals from our custodial setting to immigration and customs enforcement as permitted by state law. Tonight, I will explain the balance my agency engages in when it comes to lawfully providing ICE access to individuals who meet qualifying criminal convictions. Both local and across the nation are expressing real concern and anxiety regarding the actions and the presence of U.S. immigration. These concerns are deeply felt, if not operate within a complex and precarious framework of federal, state, and local laws. As your sheriff, I must balance legal obligations and my foremost priority, which is public safety. The Sheriff's Office is tasked with protecting every resident, regardless of immigration status, from crime, violence, and harm. I recognize that fears exist, and we are committed to transparency, lawful conduct, and policies that keep our communities safe. To set the stage for this evening's presentation, I'd like to share a few historical bills that set the standards for governing immigration law in the state of California. In 2014, the Trust Act limited local law enforcement cooperation with federal immigration detainers. In 2017, the Truth Act related to ICE interviews and notifications. In 2018, the California Values Act restricted enforcement. Since the enactment of these three pieces of legislation, the Sheriff's Office has remained committed to developing and maintaining collaborative relationships with the strengthen public trust, effective policing, and to ensure public safety. Since the enactment of the state's immigration laws, the Sheriff's Office has been working hard to build relationships with our immigrant and refugee communities, while maintaining our commitment to transparency by publishing data, reports, and policies on our public website that touch on this subject matter. The Sheriff's Office does not ask immigration status, does not investigate or enforce immigration law, does not detain an individual for an ICE full request, and does not participate in immigration raids, checkpoints, or mass deportations. We do share release date information or transfer to ICE when an individual has a qualifying conviction for state law or is authorized by a federal judicial warrant. We also participate in regional task forces that do not focus on immigration enforcement. As sheriff, I set the policy of our detention facilities, and it has always been my belief that it is safer to conduct legal immigration transfers within state statutes to avoid disruption and ripple effects taking place in our communities, and having bystanders taken in as collateral as part of federal immigration enforcement. Individuals who have been transferred to ICE are not one-time criminals. They have been convicted of crimes on multiple occasions, and if they weren't transferred due to a legal federal judicial warrant, then they are transferred due to serious qualifying convictions. In December 2024, Supervisor Nora Vargas issued a board resolution and county policy on limiting power based on case law. Only the sheriff can dictate policy within the detention setting. It is for these historical legal determinations that I have maintained the posture of following state law and the provisions that govern ICE's ability to inquire about an individual and if an interview is lawfully permitted. My teams work intently to ensure an incarcerated individual meets the qualifying markers per state law. Prior to an interview taking place, the incarcerated person is informed that an interview was requested. They have the right to accept the interview as requested. They have the right to accept with their attorney present during the interview, or they have the right to decline the interview. Individuals receive these rights in writing in a form called the consent form or Immigration and Customs Enforcement or ICE interview of an incarcerated person, the J330 consent form, which is also available in multiple languages. In 2025, the Sheriff's Office received 4 qualifying interview requests. 2 individuals agreed to the interview while to be declined. Outside law enforcement agencies, including ICE, do not have free access to any sheriff's facility or jail, and ICE is required to check in and follow professional visitor guidelines. This allows the Sheriff's Office to monitor and track access for all visitors entering any of the sheriff's facilities or jails. As part of ICE's formal process, they initiate their own form called the I-247A, which is called Immigrant and Immigration Detainer, seeking to receive release date and or notifications of release. Detainers. The Sheriff's Office does not hold individuals beyond their release. The Sheriff's Office utilizes 2 forms, as presented on the slide, that allow the individual in custody to know that ICE is inquiring of their status, and if they meet qualifications, they have their release date shared. The Sheriff's Office will not directly release an individual to ICE personnel unless ICE has a federal judicial warrant signed by a judge. In 2025, the Sheriff's Office received 1,082 release notification requests. Of those, only 188 qualified for an approved request. The slide before you illustrates the monthly breakdown of request denials and approvals. As illustrated on this slide, a total of 894 were rejected due to the thorough vetting of the Sheriff's team, which worked to ensure that requests meet state law. This historical data reflects the requests the Sheriff's Office received from ICE over the past 7 years. The obvious dip reflects the years impacted during the COVID-19 pandemic, and this year we experienced a slight decline in requests for ICE release notifications, and there was a slight decline in J335 forms, which is the notice to comply once a release date is available. As previously stated, the ability to provide release date and notifications of release information rely on the provisions within government code. Individuals who qualify for ICE to receive their release information if the individual has qualified for one of the provisions listed on this slide as governed by California Government Code, or if there is a signed federal judicial warrant for that individual. During past Truth Acts, we have received recurring questions involving individuals who are released yet didn't fall within a specific time frame as listed in SB 50. provisions that allow for an adult to meet release requirements. And these are listed before you on the screen. In May 2020, initiated Operation Guardian Angel. It's a federal law enforcement initiative aimed at neutralizing California's sanctuary. This initiative encouraged ICE officials to obtain federal judicial arrest warrants for individuals in local California jails. Consequently, in 2025, there was an increase in transfers, with 83 transfers occurring. Since the inception of SB 54, the sheriff warrants at 53, while 30 individuals met a qualifying offense. This slide is reflective of changes in legislation and how federal administration priority shaped ICE transfers over the course of the years. Prior to SB 54 implementation, the Sheriff's Office had transferred 1,143 individuals. In 2018, when SB 54 went into effect, that number significantly declined. During the COVID years, there was another steep decline. Of the 83 individuals transferred in 2025, including those with a judicial warrant, 78 self-reported as male and 5 as female. The chart on the slide provides an overview of self-reported countries of origin. The Sheriff's Office does not conduct birthplace certificate verification and reports only what is self-reported by the individual. 30 individuals who were transferred pursuant to state law had a conviction for one of the following qualifying offenses presented before you on this and the next slide. These crimes involve assault upon the person of another by any means of force likely to produce great bodily injury, battery by gassing upon the person of any peace officer, child abuse likely to produce great bodily harm or death, child molestation, a victim under 14, evading an officer while driving with wanton disregard for safety, false imprisonment, forgery, and grand theft robbery. The convictions presented, the ones that had more than one individual, were robbery, theft by force or fear, false imprisonment, assault upon the person of another by any means of force likely to produce great bodily injury, evading an officer while driving with wanton disregard for safety, residential and commercial gross vehicular manslaughter while intoxicated, identity theft, intent to defraud, kidnapping, possession of illegal substances in a jail facility, receiving stolen property, possession of a stolen vehicle or vehicles or vessel, residential and commercial burglary, entering with intent to commit theft, robbery, theft by force or fear, threat of violence or violence toward a peace officer in performance of their duty, transportation, importation, sale of narcotics, including opioids and cocaine. And we saw instances of offenders repeating the following crimes: robbery, false imprisonment, with wanton disregard for safety, residential and commercial burglary, and entering with intent to commit theft. I'd like to emphasize that these are serious and sometimes violent crimes, and they represent real victims in our communities. Since serving as your sheriff, I continue to speak on the Sheriff's Office's unwavering commitment to fostering a safe and inclusive environment for all residents of San Diego. The position I've taken is based on the foundation of representing the voices of victims, as well as ensuring and is impacted by state law. I believe it's for ICE to alternatively create a situation where ICE could seek individuals in the community setting. We have all seen around the country how disruptive this can be and how traumatizing this can be for our communities and for anyone else who is contacted by ICE who can face deportation. As I've repeated over the last 3 Truth Acts, it is safer for everyone involved if I follow what is allowed under the state law. When we look at the 83 individuals who were transferred to ICE this year, these individuals generated 245 bookings into the jail system over the course of the last 7 years. My policy is based on enforcement as well as prevention and not politics. My focus is on those who are committing serious crimes and victimizing our communities. When someone chooses to act with wanton disregard for the law, they must also recognize that their decisions carry consequences. Those impacts are not accidental or unforeseen. They are a direct result of choices made. Accountability is not just about legal consequences, it's about acknowledging the ripple effects of our decisions and how they affect those closest to us. We can hold compassion for families while also being honest about where responsibility lies. Whenever a serious crime is committed, there often lies a victim on the opposite end who lives with that trauma. I stand firm in my belief that it is crucial for every member of our communities to live with dignity, security, and the opportunity to thrive. By upholding the principles of transparency and accountability, we can build stronger relationships between law enforcement and our diverse communities. Chair Lawson, members of the board, this concludes.
So Sheriff Martinez will begin with the first part. What does interpretation? So Sheriff Martinez will begin with the first part. What does interpretation and...
Let me just pause. That was a clever of the submitted question.
There's 130 questions in that question.
7 parts. And maybe next time that's 7 questions. Let me go ahead for now. Thank you.
The first part reads, what does interpretation and or translation access look like for anyone in your custody?
Thank you for the question. The San Diego Sheriff's Office offers translation services to everyone in our custody to ensure that they understand their rights while in our custody. All ICE-related forms are available in 7 identified languages: English, Spanish, Chinese, Tagalog, Vietnamese, Korean, and Arabic.
Second part is, what systems do you rely on to determine someone's identity and personal identifying information, such as county of origin, particularly for those who can't communicate in English?
Well, obviously, if they have a valid ID on their person when they're booked, or if they provided identification to the arresting officer, we will have that. But demographic information is self-reported by the incarcerated person during the booking interview, and if the individual is unable to speak English, translation services are provided.
Third part, what types of community member data is shared with ICE, DHS, CBP, and through which mechanisms or systems is that information transmitted?
So for individuals that have been determined to have a qualifying conviction and have an approved J340 form, the San Diego Sheriff's Office staff provides a notification to ICE via telephone, which provides ICE the release date. The San Diego Sheriff's Office provides general information for the individuals in custody via the Who's in Jail app, and that just basically gives a date of birth, sex, race, height, weight.
Fourth part, is any personal data being shared before a transfer has been made over to federal officials?
During the course of a detention, arrest, or investigation or interrogation, the Sheriff's Office personnel are prohibited from a number of things, and I'll list them: inquiring into a person's immigration status, detaining an individual on the basis of an immigration hold request, providing information regarding an individual's release date, or responding to a request for notification of release dates to the immigration authorities, or other information unless that information is available to the public or is in response to a notification request from immigration authorities in accordance with California Government Code Section 7282.5, where prohibited from providing personal information as defined. Sorry, making sure I'm saying that rightly. Providing personal information is defined in California Civil Code Section 1798.3 about an individual, including but not limited to an individual's home address or work address or other identifying information, unless that information is available to the public, making or participating in arrest based on a civil immigration warrant, assisting immigration authorities in activities described in Section 1357A3 or Title 8 of the U.S. Government Code, and that is it.
Thank you. Part 5, what access and privileges are granted to ICE or other federal agents on county property, including non-public areas?
Outside law enforcement agencies do not have free access to any sheriff's facilities or jails. They're required to check in via the primary entrance point, and they follow professional district guidelines.
Sixth part, how is the determination made that a person is a non-citizen, and what protections and accountability measures exist to prevent wrongful detention or transfer, including of U.S. citizens?
So the Sheriff's Office does not have the capability to access or look up an individual's immigration status. We do not have access to any databases that contain information about an individual's current immigration status. It's in accordance with our operational protocols and legal requirements, and additionally, our jail population management unit is prohibited by law from communicating with immigration officials about an individual's immigration status. Our unit strictly adheres to these legal constraints to ensure compliance with all relevant regulations. Our operations rely heavily on the inquiries made by immigration officials. When immigration officials reach out to us, it's typically to notify us that they, ICE, are questioning an individual's immigration status. This usually implies that an individual may not be legally present in the country, and the officials are seeking to determine if the incarcerated person qualifies under the SB 54 guidelines.
And the last part of this question, the Values Act statistical report includes information of at least 5 individuals who reported being U.S. citizens. What are the circumstances in which a U.S. citizen would be transferred to federal officials?
Citizen status is self-reported information provided by the incarcerated person during the booking process. The sheriff's office does not have the ability to investigate their immigration status, and it's against the law for us to do so.
Andrew's telling me to pick another. 15.
Question 15 has 20 parts. We'll start with the first one. Since February 27, 2026, how many individuals has the Sheriff's Department transferred to ICE custody?
This information will be available in August of 2026, followed by quarterly reports.
Of those transfers, since February 27, 2026, how many were supported by a judicial warrant as required under San Diego's CLEAR ordinance?
This information will be available in August 2026, followed by quarterly reports.
Does the department intend to fully comply with the San Diego County CLEAR ordinance? If yes, what specific policy changes, training, and accountability measures have been implemented? If no, what is the legal basis for declining compliance with state and local law?
There's a little bit of two-part. We did undergo the CLEAR Act training that was provided to our agency. We have submitted facilities for the signage under the ordinance. But as an independent elected official, I set the policy for the Sheriff's Office, and California law prohibits the Board of Supervisors from interfering with my independent, constitutionally and statutorily designated investigative function as a sheriff. And it's clear that I have the sole and exclusive authority to operate the county jails. State allows the Sheriff's Office to share release dates for individuals who are in Sheriff's custody only if they have qualifying convictions for specific serious violent or sex crimes. SB 54 gives the authority for law enforcement to cooperate with immigration authorities as prescribed, and many are referencing that because the board policy is in place, they have to follow it. However, unlike a local police department where the elected city council can set the policy for the chief of police, that the council appoints an elected sheriff answers to the voters and sets the policy for the sheriff's office. The provision reference of policy doesn't impact the sheriff, however, applies to local police departments where their city governments establish their policies on SB 54 provisions.
Part 4, for all individuals transferred to ICE in 2025, what specific statutory exceptions under SB 54 were used to justify each transfer where a judicial warrant was not presented?
So that goes to the different crime charges, 11352A, Health and Safety Code, 491.5.5B of the Penal Code, 207A of the Penal Code, 211 of the Penal Code, 236, 237 of the Penal Code, 236, 237A of the Penal Code, 243.9A of the Penal Code, 245A4 of the Penal Code, 245A4 of the Penal Code, 17B4, 273A of the Penal Code, 2800.2A of the Vehicle Code, 288A of the Penal Code, 4573.6 of the Penal Code, 459PC, 470B of the Penal Code, 487.2 of the Penal Code, 212.5B of the Penal Code, 530.5C1 of the Penal Code, and 69 of the Penal Code.
In cases where individuals were transferred despite convictions older than 15 years, including those from 1995, 1996, 2005, and 2008, what legal rationale allowed those transfers under SB 54?
So Section 1, the individual has been convicted of a serious or violent crime identified in subdivision C of Section 1192.71 of or subdivision C of section 667.52 of the Penal Code. Section 2, the individual has been convicted of a felony punishable by imprisonment in state prison. Section 4, the individual is a current registrant on the California Sex and Arson Registry. Section 5, the individual has been convicted of a federal crime that meets the definition of an aggravated felony as set forth in subparagraphs A to P, inclusive of paragraph 43 of subsection A of section 101 of the Federal Immigration and Nationality Act, 8 U.S.C. section 1101. Section 6.6, the individual is identified by the U.S. Department of Homeland Security's Immigration and Customs Enforcement as a subject of an outstanding federal felony warrant.
Part 6. How does the Sheriff's Office ensure consistent and legally accurate interpretation of SB 54 eligibility criteria?
We stay up to date with current California legislative bills that are signed into law that impact SB 54 provisions. We do training bulletins and we work with the Sheriff's legal team for interpretations.
Through what mechanisms is information shared between the Sheriff's Office with federal officials or agents, for example, databases, direct communication, and joint task forces?
So there's a telephone call for notification of those individuals that are qualified for SB 54. Federal law enforcement officers have San Diego Law, which is a local criminal history system.
Part 8. Are federal immigration agents permitted to enter sheriff's non-public areas? For example, sally ports, intake areas, parking facilities. If so, under what policies or agreements?
Outside law enforcement agencies do not have free access to any sheriff's facility or jail. They are required to check in via the primary entrance point and follow professional visitor guidelines.
What local or regional databases or communication systems are used to facilitate information sharing with federal immigration authorities?
Federal law enforcement officers have SD Law access, which is a local criminal history system.
Part 10. Has any federal agency asked the Sheriff's Office to conduct a traffic stop, a whisper stop of a civilian? How many of these stops have resulted in an immigration-related detention?
The Sheriff's Office works with law enforcement partners to disrupt drug trafficking and criminal activity that violates state law but not immigration law.
Part 11. Does the Sheriff's Office have a policy to address requests from federal agencies to assist with a stop, assist with crowd control, or a call for cover? Can you make any policies public?
There isn't a policy that addresses requests from federal agencies. We treat requests for cover calls the same regardless of what law enforcement agency calls for that help.
Part 12. What local resources, including staff time, facilities, transportation, or equipment, are used by the Sheriff's Office to support federal immigration enforcement activities?
A staff study has not been performed to capture this process, and staffing has not been increased to accommodate any fluctuations in request for monies.
How does the Sheriff's Office track and report the use of these public resources? How much is the value in dollars of these public resources?
Staff study has not been performed, and we have not increased our staff to accommodate IT requests.
Part 14. What safeguards exist to prevent the wrongful detention, notification, or transfer of U.S. citizens to ICE by the Sheriff's Office?
We do not ask anyone their immigration status, and it's important to note that San Diego Sheriff's Office does not have the capability to access or look up any individual's immigration status. We do not have access to any databases that contain information about an individual's current immigration status, and this is in accordance with our operational protocols and legal requirements. Additionally, our jail population management unit is prohibited by law from communicating with immigration officials about an individual's immigration status, and our unit strictly adheres to these legal constraints to ensure compliance with all relevant regulations. Our operations rely heavily on the inquiries made by immigration officials, and when immigration officials reach out to us, it is typically to notify us that they are questioning an individual's immigration status. This usually implies that the individual may not be legally present in the country, and the officials are seeking to determine if the incarcerated person qualifies under SB 54.
Part 15. How does the Sheriff's Office respond to documented cases in which individuals reported being U.S. born but were still transferred or referred to ICE? What oversight, auditing, or complaint mechanisms are in place to detect and correct these errors?
The same answer as previous. We just don't do it.
Part 16, how is demographic data, including ethnicities such as Native American identity, collected and verified by the Sheriff's Office in ICE transfer reports?
This information is self-reported and collected into the jail information management system. That's where
Second, part 17, you kind of answered this, but are individuals self-identifying, or is this information assigned by staff or derived from other records?
Yeah, self-identifying.
Part 18, what internal policies, legal guidance, or supervisory approvals are required by the Sheriff's Office before honoring ICE requests?
Our process is governed by SB 54, the California Felonies Act.
Have these policies changed in the last year? If yes, what are the changes?
There have been no changes to our policies.
And the last part of this question, are you concerned that continued ICE notifications and transfers by your office expose individuals to prolonged or mandatory detention and deportation under current federal policies, including the denial of bond and serious concerns about detention conditions that have led to a historic number of deaths? Given these risks, are you willing to halt transfers of community members to ICE custody?
It is concerning the things that we see in the news. There's no ignoring what we've seen across the country. However, I do think it's still in the best interest of public safety that we can move forward.
Number 20.
Number 20 reads, is the probation department complying with policy L2? Does the probation department intend to comply with the CLEAR ordinance?
Probation is not here, I can't report them, sorry.
Oh, you are,
No, I apologize.
sorry, that's okay. So probation department does comply with board policy L2 and that of the California Truth and Values Act. They intend to and do comply with all laws, policies, and ordinances, including the CLEAR ordinance.
Only one part.
Question 11 reads, will you commit to stopping ICE access to county facilities?
No. The short answer.
Number 4.
This question has 6 parts. First part, why does the San Diego Sheriff's Office refuse to honor board policy L2?
Since becoming the sheriff, I've been committed to balancing the requirements of state law and the sheriff's office policies and procedures, which have incorporated input from community immigration activists. Current state laws that regulate local law enforcement's ability to cooperate with immigration enforcement authorities have gone through tremendous discourse during their respective legislative process. There is no loophole when it comes to what is placed in statute. While there have been legislative efforts to amend and expand the reach of immigration laws, Governor Newsom vetoed the most recent proposal, indicating that he believes current law strikes the appropriate balance with public safety. As an independent elected official, I set the policy for the Sheriff's Office, not the Board of Supervisors. California law prohibits the Board of Supervisors from interfering with my independent, constitutionally and statutorily designated investigative function as a sheriff. And it's clear that I have the sole and exclusive authority to operate the county's jails. State law allows for the Sheriff's Office to share release dates for individuals who are in sheriff's custody, and only if they have qualified convictions for specific, serious, violent, or sex crimes. SB 54 gives the authority for law enforcement to cooperate with immigration authorities as prescribed. Many are referencing that because the board policy is in place, but I have to follow it. However, unlike a local police department where the elected city council can set the policy for the chief of police, that council appoints an elected sheriff, answers to the voters, and sets the policy for this office. The provision reference of policy doesn't impact the sheriff, however, applies to local police departments where their city governments establish their policies under SB 54 provisions.
Part 2 for this question, how many total sheriff staff are responsible for vetting individuals to assess if they are eligible to be transferred or not under SB 54?
We have 27 employees that work our general population management unit, and there's one of their duties.
Next part reads, how much are their salaries? This discretionary use of county resources for intake, vetting, notification, and transfers is not supported by County Policy L2, nor by community testimony at past Truth Act forums. The sheriff claims that she has not added staff to handle the increase in ICE requests for notifications. In 2024, 1,236, and transfers from 25 in 2023 to 83 in 2025.
So I would invite this requester to go to the Sheriff's Office webpage and submit a Public Records Act request, since this request will require an extensive amount of information gathering.
Part 4, what other types of adjustments did the San Diego Sheriff's Office make to handle the additional cases?
There's been no additional adjustments.
Part 5, what other staff functions or funding for alternate community safety programs could be adopted if the sheriff would stop her discretionary collusion with ICE?
I'm not sure if this question is more appropriate for the board.
The last part of this question, as immigrants enter and exit the San Diego Sheriff's Office custody and databases, what is the sheriff doing to prevent disparate treatment due to racial profiling or place of birth?
We work closely with our community partners and organizations on voter rights efforts and presentations, as well as educating on hate crime laws.
Number 3.
Question 3 has 6 parts with a few subparts. Let's start with the first part. Can you walk us through where in the booking release process the judicial warrants come up, and how the Sheriff's Office responds to these within the SB 54 vetting process?
Federal immigration warrants are not subject to the provisions outlined in SB 54.
Once the Sheriff's Office receives a judicial warrant, how does the office verify that it's signed by a judge?
The warrant is received with a signature from the judge, and the sheriff's staff will visually inspect the warrant upon receipt and process the warrant.
How does the receipt of a judicial warrant for an individual in sheriff custody affect the sheriff's SB 54 vetting process for individuals?
Federal criminal immigration warrants are not subject to the provisions outlined in SB 54, and once the warrant is received, the vetting process stops.
What are the forms and frequency of communication between ICE and sheriff staff about individual warrants?
The forms are federal judicial warrants, and we can only speak to the number of warrants that were received, 53 in 2025.
If a judicial warrant is received right before a person is about to be released, how does the department respond? For example, some individuals were slated to not be transferred to ICE custody, but we notice a judicial warrant is received the same day they're meant to be released.
Federal immigration warrants are not subject to the provisions outlined in SB 54, and they are processed upon receipt.
Part 2, when will the San Diego Sheriff's Office begin to post the monthly data about the number of interviews, notifications, and transfers on the sheriff's website?
So the monthly is not possible for us as far as our ability and data, the ability of our IT staff to pull that data on a monthly basis, but we are looking to begin issuing quarterly reports starting in August of 2026.
The next 2 subparts appear to be statements. I'll read them. Both supervisors and community advocates have repeatedly requested for years that the San Diego Sheriff's Office post data about the number of interviews, notifications, and transfers to the sheriff's website on a monthly basis. In fact, we made this request during last year's Truth Act forum, and the sheriff shared she would look into it. The Sheriff's Office tracks this data on a monthly basis to prepare for annual reporting requirements under the Truth Act and SB 54, so there's no reason why this would be an extraneous task for the department. Part 3, what did the sheriff mean when she responded to the question submitted to the 2025 Truth Act with, quote, there are indications this administration is also utilizing warrants in an unprecedented fashion, end quote. Also, why are we seeing a rapid increase in ICE using judicial warrants to facilitate transfers from the San Diego Sheriff's Office?
Thank you. This quote was based on public statements from the administration, and in May of 2025, the U.S. Attorney's Office initiated Operation Guardian Angel. It's a federal law enforcement initiative aimed at neutralizing California's sanctuary state policies. This initiative encouraged ICE officials to obtain federal judicial warrants for individuals in local California jails.
Part Part 4, how does the San Diego Sheriff's Office ensure that they are not transferring U.S. citizens into ICE custody? In 2025, there were 5 individuals who reported their place of birth as the United States of America. How and why does San Diego Sheriff's Office ask individuals who enter the San Diego Sheriff's Office custody to self-report their country of birth and citizenship during the booking process? How does this occur? Orally, in writing? How does an individual opt out? Can they refuse to answer? What are the consequences of refusing to answer? What % of individuals refuse to self-report? How do you use this information?
So that had a lot of parts. So the Sheriff's Office does not have the capability to access or look up an individual's immigration status. We do not have access to any databases that contain information about an individual's current immigration status. This is in accordance with our operational protocols and legal requirements. Additionally, JPMU is prohibited by law from communicating with immigration officials about an individual's immigration status. Our unit strictly adheres to these legal constraints to ensure compliance with all relevant regulations. Our operations rely heavily on the inquiries made by immigration officials. When immigration officials reach out to us, it's typically to notify us that they are questioning an individual's immigration status, and this usually implies that the individual may not be legally present in the country, and officials are seeking to determine if the incarcerated person qualifies under SB 54 guidelines. As far as how and why does DSO ask individuals to enter the custody to self-report, there are countries that require mandatory notification if a citizen of their country is arrested in the United States, and if the self-reported place of birth is a mandatory notified country, the sheriff's staff will notify their embassy or their consulate. If it is a non-mandatory country, the incarcerated person will still be given the option to request their embassy or consulate be notified. And it occurs through the Sheriff's International Liaisons, and it's done via the phone or via email or text message. And the individual can opt out of self-reporting their place of birth, and we don't have a percentage of individuals who refuse to self-report. This information does not track, and we use the information to make required notifications to the respective embassy or consulate.
Part 5. Will the sheriff share redacted versions of the judicial warrants that were used to facilitate past transfers, 2024, 2025, 2026, and on a monthly basis going forward onto its public website for public review?
No, but there may be the availability of some of that information through our GovQA or Public Records Act platform.
In 2024, we saw an unprecedented number of federal judicial warrants for individuals in custody. Despite a request from community organizations, the sheriff declined to provide the specific violations or offenses for the individuals transferred under the offense code of federal warrants. Next part, subpart of that reads, during 2025, we see the largest number yet of federal judicial warrants used by the San Diego Sheriff's Office to transfer individuals to ICE and DHS custody. Next subpart reads, in the interest of transparency, so we can better understand this disturbing trend, would the sheriff promptly provide complete information on specific violations or offenses for each individual transferred under the offense code of judicial warrants in 2024, 2025, 2026, and on a monthly basis going forward in 2026?
Yeah, as I stated in my last answer to the last question, no, but it might be available through our Public Records Act request, our GovQA website.
This last subpart is a statement. Our PRA requests have not received the priority responses that we would expect and that are required by law. We need this information promptly. The final part of this question, who other than the sheriff is responsible for safety and access to parking lots on county property?
The law enforcement agency of jurisdiction. So if it's downtown, it would be San Diego Police.
Subpart of that question reads, the sheriff denies responsibility for informal practices that circumvent SB 54, such as parking lot pickups, because she doesn't have custody over individuals once they are released from county jails, as per reply by sheriff to question 14 of the Truth Act form 2025. Final question to this part reads, why does the sheriff continue to collude with ICE and deny her role in this devious practice, stripping immigrants of their safe and lawful return to the community? This
So I think people misconstrue my authority. Once someone has been released from my custody and is in a public venue, I don't have authority over another law enforcement agency to engage in their lawful duty.
Okay, number 13. I think this is the last question.
Thank you, Chair. Question 13 reads, with the L2 policy and the clear ordinance, the only legal way for the Sheriff Department to transfer an individual to ICE is when a valid judicial warrant is presented. Do you agree with the statement? If not, provision of the law and explain legal basis of transfer without a valid judicial warrant.
So SB 54 clearly gives me that authority under certain is involving certain criminal convictions under state law.
Are we done? 10 seconds left. Okay, I think that's all we can do. These questions, how many do we have left? Quite a number. Okay, so these will be sent to Sheriff Kelly Martinez. Sheriff Martinez, if you could provide a written response.
We will. We'll post it on our website along with the ones I answered tonight.
Okay, great. So we'll have available for the public written responses of not only what was answered here tonight, but also whatever we did not understand to answer. So thank you very, very much. Appreciate that. Okay, so now I'm Sheriff Martinez, if you can go ahead and feel free to sit down, and we will have public comment. And then after that, we'll have an opportunity for the board to ask questions.
Thank you, Chair Lawson-Rainer. We have 35 requests to speak on this item, 23 in person and 12 requesting to speak by phone. Also note that we received 29 comments, 15 in support, 7 in opposition, and 4 neutral. For any individuals that requested to speak on this item by phone, please dial into the conference line using the instructions that were provided to you. We'll begin with the group presentation. We have one request for a group presentation. We will have 10 minutes to address the board, and all 3 members of your group must speak during that 10 minutes. We'll ask you to please self-regulate your time with the timer on the podium. I'd like to invite 40 individuals in the group presentation. Luis Guerra, Alondra Alvarez, Jay, and Dini Lacabana. As we're getting the technology set up, if I could have each of you please state your name and introduce yourself before I start. Just go ahead and say your name.
Luis Guerra.
Great. And the next speaker, please.
Alondra Alvarez.
Thank you.
Jay.
Thank you.
And it's cute of me.
Thank you. All right, I'll go ahead and begin your 10 minutes. And again, please self-regulate your time. As a reminder, each person in the group may speak for no more than 4 minutes. As you come forward, as you did, state your name. We're going to go ahead and begin your time.
Good evening, chairs and members of the board. My name is Luis Guerra, and I serve as the state policy director of the Immigrant Defenders Law Center. We're the largest nonprofit deportation defense firm in California. We're also proud members of the San Diego Immigrant Rights Consortium, a coalition of faith, labor, legal, and community organizations. A coalition that's here and deserves due process, humane treatment, and dignity. We urge the Sheriff's Department to immediately comply with county policy and state law by ending its entanglement with ICE. Now more than ever, we must ensure that discriminatory and deadly federal practices are not facilitated by local resources. California's laws, including SB 54, make clear that our state has chosen to safeguard public safety by ensuring local resources are not used for federal immigration enforcement. These laws grant limited discretion for cooperation with ICE only when such cooperation does not violate federal, state, or local law or local policy. This limitation is reaffirmed in guidance issued by the Attorney General. Because state law leaves open some discretion for local law enforcement, our San Diego community acted to close those loopholes. With the passage of County Board Policy L2 and the clear ordinance, The county made its intent explicit. County resources and funding must not be used for immigration enforcement. Under these policies, ICE notifications and transfers without judicial warrants violate both local notifications and transfers without judicial warrants violate both local policy and state law. We ask the board and the sheriff.
Hello, for the record, my name is Ana Margares, and I'm a community educator at the University of Popular, as well as an advisory board member of the San Diego Immigrant Rights Consortium. More than half of these ICE transfers involve people from North County. That's 45 out of 83. I'm here representing North County as someone that assists families directly impacted by these raids. Not a day goes by that we don't meet a new family on what ends up being the most traumatic days of their lives. We know the rebuttal and justification of ICE transfers that is said in response to these statistics, that these are the worst of the worst. Everyone has the right to due process, and this rhetoric that dehumanizes people, strips them of dignity, and brands them disposable criminals is what has weaponized hate against our communities. The sheriff talked about making our communities safe, but this is what makes this. I have friends in law enforcement. Trust law enforcement. Involved in ICE activity erodes trust and makes people less likely to engage with law enforcement, even when they themselves are witnesses to crime. When sheriff can't make clear distinction and answer community demands of following state and local law, it warrants that lack of trust. Community members are scared to leave their homes, to send their kids to school, to go to the hospital. This just happened recently in our community. A medical emergency occurred and they did not call 911, they called us. When did it become our responsibility to become first responders when they are the ones, the sheriffs are the ones that receive the multi-billion-dollar budgets to take care of our community? These high numbers of these transfers is the historic truth of immigration enforcement in North County.
Good evening. I am here on behalf of Detention Resistance. We are a non-hierarchical and abolitionist collective rooted in the Zapatista principles of self-determination and accompaniment. We support and organize with immigrant communities criminalized and targeted by the state with the express mission of shutting down the Otay Mesa Detention Center, or OMDC. We have been doing this work alongside people currently and formerly detained at OMDC since 2018. A lot has changed since we first came together 8 years ago, but what has not changed over 3 presidential terms, 2 state governors, 2 city mayors, and 3 county sheriffs is the inhumane and abusive conditions that our community members are subjected to at OMDC. According to a report published by the ACLU in 2021, DHS guarantees CoreCivic a minimum payment of $154.24 per person detained in ICE custody per day for up to 600 beds, and an additional $138.29 per day for every person beyond that. Despite tens of billions of dollars in funding and seemingly interminable promises of budget increases from politicians pandering to and stoking xenophobic and racist fears, we know none of that money goes to improving conditions inside. Immigrants are being asked to sign voluntary departure forms under duress, with false promises, without due process, and without access to legal counsel. Via pretermission, many of them are being denied the opportunity to even have their asylum claims heard here. As if that were not enough, our compas are forced to endure wholly inadequate medical attention, from delays in getting life-saving medications to delays in receiving the appropriate diagnostics for their very concerning symptoms, retaliation for filing grievances and speaking out, food that is bereft of nutrition at best and inedible at worst, frequent temperature extremes that predispose people to getting sick, and a complete disregard for tending to communal hygiene. To the people that matter, our families, friends, and neighbors, it is clear that the profitable swamp of immigrant detentions and its eager collaboration with sheriff departments serves toward perpetuating a culture of fear across our border regions. It is a political choice to collaborate with ICE and DHS as the Trump regime escalates xenophobic policies as it fails to deliver domestic economic prosperity. It is in these escalations that the argument for the abolition of ICE makes itself. It is in the worsening of detention center conditions that the call to abolish detention centers is loudest. Make no mistake, this is not a problem that can be rectified by funneling even more resources to a death-making institution. An economy of incarceration and cruelty politics cannot be our future. We demand an end to all ICE transfers.
Hello, County Board Supervisors and everyone. Thank you for having me here. I'm going to speak from the heart. My name is, of course, y'all know, Cupid Mimi. I am the founder of Fat Camp HAT, and I'm a pillar of the community. Today, I'm just here to give you guys a testimony. January 29th, my nephew was pulled over for having tinted windows, and he was detained and taken into custody in South Bay. After serving about 30 days, I was told, actually it was 10 days, I was told that we can go pick him up. When me and family and a few community members get there, we were told to wait for him to come out of custody. I had a deep feeling in my chest that something wasn't right. When we get there, we're waiting or whatnot, and I asked the lady, I said, what's going on? Why is my nephew not being let go? They say that he has a hold on ICE. When all that goes about, ICE gets there, I approach them, everything I'm saying is on video. I tell them, that this ain't right, you're not supposed to hold them. Long story short, they gave me the runaround, they told me to wait. I wanted to at least give my nephew a hug. He's been in the country for 15 years, 29 years old, came when he was like 14, 15. And they gave me the runaround to the point where I had to literally chase ICE because they met downstairs with the sheriff's department to take my nephew. Not only is my nephew detained, they later, like 8 months later, my nephew got dropped off in the middle of nowhere in Mexico, giving a choice whether Mexico or Alcatraz, or some alligator place or whatnot. My nephew got dropped off in the middle of Tabasco, Mexico. To this day, I contact my nephew every day. Given everything that's going on in Cuba right now, my niece has been basically threatened and told that, all her rights, her Medi-Cal, everything is being taken from her due to March 2025 when Trump came up with the humanitarian parole. So this is stuff that me being really involved in the community, my nephew looks just like me, Afro-Black, in the middle of nowhere where he's being easily, recognizable or whatnot. Everything that's given, just the whole fact that my niece alone, my uncle, it's just so many family members right now that are still, in the process of being deported. It's really hard to understand how is the sheriff, in my eyes, able to not just violate that, but get away with what they did. So again, I'm representing for those who don't have a voice, those who are now deceased in the custody of all these detention facilities, and it's very painful. It's very painful because till this day, although we're fighting for everything that's going on in the communities that I come from, immigration is getting completely out of control, out of hand, and being pulled over for tinted windows to later being asked for all type of identifications and then being arrested and sent to the middle of nowhere. Just imagine how we feel.
Thank you. Thank you. We will now begin with the in-person speakers. As your name is called, if you could please come forward and stand on the arrows until it's your turn to speak at the podium. You will then have 1 minute to address the board. You can please begin by stating your name for the audio record. We will be calling individuals in groups of 3, so please listen for your names. And I'd like to invite forward the first 3 individuals: C.K. Calderon Vargas, Jesus Martin Gallegos Munoz, and Margaret Baker.
Good evening. My name is Dr. Sica Calderon Vargas. I am here on behalf of the San Diego LGBT Community Center and our LGBTQ immigrant community members, people who already face compounded fear and vulnerability simply by existing. Every dollar the Sheriff's Department spends coordinating with ICE is a dollar taken from the people of this county. The Sheriff's budget is more than sufficient. It should not be redirected to do federal government's job, especially not to tear apart families, including LGBT folk who have fled violence and persecution and found a home in San Diego. We are asking you to do what is right to comply with Board Policy L2, the clear ordinance, and California state law now.
Good afternoon, my name is Jesus Martin Gallegos Munoz. I am a community organizing coordinator at the Chicano Federation and a resident of District 1. At the Chicano Federation, we strongly believe that everyone deserves to live a life free from fear and with equitable access to opportunities that provide them with greater access to equity, justice, and progress. As members of a disenfranchised and marginalized community, we understand the fears and worries that our community members face in these difficult times, and as such, stand in solidarity with our diverse immigrant and mixed status families. In a time when our federal government is killing U.S. citizens, our immigrant and mixed status individuals fear for their lives. The 83 ICE transfers in 2025 were nearly triple the number from the year before, and at least 30 took place without the federal judicial warrant required by county policy. This alarming increase in the sheriff's collaboration with ICE comes aimed at hiding fear immigrant communities and escalating abuse by federal immigration agents. On behalf of the Chicano Federation, I demand that the sheriff uphold local and state laws and stop using public resources.
Next speaker coming forward, I'll call the next three speakers. Monica Lon Garcia, Salvador Sarmiento, and Cesar Javier.
Good evening, my name is Martha Baker. I'm here as part of the Fuera Amiga working group and a longtime resident of South Bay District 1 to demand an end to all county collaboration with ICE and Border Patrol. For nearly a decade, we've been calling for change, in particular to stop the sheriff's collusion or voluntarily admitted practice of ICE transfers and sharing of our data and other county resources for federal immigration. Over the past year, ICE and Border Patrol escalated their violations of civil and human rights. Their violent and harmful tactics became more visible, widespread, and unpredictable. Locally, we scrambled to rescue, support, and educate impacted community members. But to reduce these abuses in San Diego and mitigate some of the horror and harm that ICE CDP inflict on our community members, our sheriff can simply stop all collaboration, stop turning a blind eye to parking lot pickups, stop providing data used to monitor. We need a sheriff who serves us, not the run-amok federal agencies.
Good evening, supervisors and Sheriff Martinez. I'm Monica Langarita, Deputy Legal Director at the Center for Human Rights and Constitutional Law. I'm an attorney and a lifelong resident of San Diego County and a member of the Fuera Amiga San Diego Working Group. We're deeply concerned by the increase in transfers, by the increase of the number of people that the Sheriff's Office has voluntarily transferred to ICE over the last year. Under state law, all transfers remain voluntary, even those permitted under SB 54 by judicial warrants. Sheriff Martinez said that judicial warrants are not subject to SB 54, but that doesn't make sense. Cal Government Code 7284.684 says California law enforcement agencies shall not transfer unless authorized by judicial warrant or judicial probable cause determination or under any of the criminal carve-outs. Nothing in SB 54 says transfers are required upon receipt of a judicial warrant. And if Sheriff Martinez is invoking some independent authority, she should say what that is. Thank you very much.
Thank you. Next speaker, Salvador Cesar. Not seeing any movement in the chamber. We'll go to the next three speakers, allegedly Audra, Michael Brando, and Ines Delgado.
It's interesting because due process would be to deport somebody that's here illegally, and I find it interesting that nobody cared about the exploitation of these people as they were being brought here across to our nation. Nobody cared about the children that went missing, over 300,000 children, the 2,000 children that were at the convention center that went missing, Core Civic that was sexually assaulting these people as they were coming in, the NGOs making money off of these people coming in and them going out. Nobody cared about that. It's very interesting that now we see the ripple effects of what has been happening, and people don't like that, ICE is coming after that. But what about when they were coming here? What about the rape tree in Jacumba? What about the children that would drop their IDs? I have so much evidence, but nobody saw it because you guys see what's in the community. You didn't see what was happening on the border, and you didn't care then. So it's interesting that you care now because people were being bused back to Tabasco on a 3-day bus ride just because they went into Mexico. So it's like, God.
Good evening, my name is Ines. I am an immigration advocate with the North County LGBTQ Research Center and a member of the Fuera Migra Working Group. Under California law, cooperation with ICE is discretionary, not mandatory. Government Code 7282.5 makes clear that transfers are never required. Even when supported by judicial warrants, these transfers remain a choice and one that must comply with local law. Yet the Sheriff's Office continues to carry them out. We are especially concerned about the growing reliance on judicial warrants, even in cases involving only immigration-related allegations, not public safety threats. Records also suggest that some individuals are transferred on the very day they are scheduled for release, raising serious concerns about transparencies. That's why we are calling for the monthly public release of all transfer data and communications related to judicial warrants. These decisions have real consequences. My own family was separated because of an ICE transfer. What becomes lawful in your eyes is what creates a chain of violence. We urge you to follow state and local law and end all ICE transfers and this collaboration. Thank you.
Say go. Brenda said yes. And then just if you could start by letting us know your name.
Sure. How much time?
1 minute.
1 minute. Thank you. Salvador Sarmiento, Salvador G. Sarmiento, attorney and campaign legislative director with the National Day Labor Organizing Network. Just two quick things. One is, this is a state-mandated truth transparency forum for any collusion with ICE, for the transfers with ICE. So if you're mandated by the state to have one of these forums, you're already guilty of colluding with ICE. And in a moment like right now, where we're all watching the human rights violations being committed by this federal militarized rogue agency, that's outrageous. What we shouldn't be doing any business with ICE. So the first point is just that. The second point is that ICE hosting these transfers, which are completely voluntary, is a force multiplier for ICE. So we're enabling the human rights violations that are taking place in other states and here in California and here in San Diego. So that's in the sheriff's power. You know they're not a professional, legitimate law enforcement agency, and it's in your power to do better. And we all got to step up to this one. So that's all I have to say. Thank you.
Thank you. I'll call the next three speakers: Mark, Patricia Mondragon, and Laura Alvarez Lopez.
Hello, for the record, my name is Laura Alvarez Lopez. Good evening, Acting Chair and Supervisors. I represent Universidad Popular, a community-based organization embedded in District 5. We're also core members of the Fuera Migra San Diego Working Group. Fuera Migra works to decriminalize immigrants in San Diego County. We strongly reject the sheriff's entanglement with ICE, and we urge an end to all notification and transfers. I'm here to clearly register Universidad Popular's position. For the 8th year in a row, I come before this body during a Truth Act forum to speak to the harm these practices continue to cause in our region. Year after year, we show up to uplift human rights, dignity, and due process for immigrant communities. Year after year, we're told there's no need to change practices by the sheriff. We continue to call for transparency and accountability from the sheriff's office, and yet we get vague responses and unclear answers. Clearly, the sheriff's not going to protect our community, so what are you going to do about it, supervisors?
Good evening, Patricia Mondragon, Regional Policy Manager with Alliance San Diego. I have to point out, equally to Sal, that this is a truth forum, and yet we got a lot of no answers or sending in a PRA. And that was quite offensive to the community for not providing concrete answers to our questions. Also, the sheriff spoke about wanton disregard for the law, accountability, and personal choices, while she herself is not following state and local law. In detention, people are being denied necessary medical care and sufficient food, pushing them into dangerous conditions and deepening desperation, conditions leading to a record number of deaths in U.S. immigration custody. We demand that the sheriff comply with local and state law and immediately end the use of county resources for detention, deportation, and family separation. The sheriff is not above the law, and our communities deserve safety, dignity, and due process.
Thank you. I'll call the next three speakers, Fiona Martinez, Alexandra, and Pedro Rios.
Good evening, supervisors. My name is Pedro Rios, and I'm director of the American Friends Service Committee's U.S. Mexico Border Program. I want to be short. Since 2003, for 23 years, we've been documenting the abusive practices of ICE. ICE, when we used to show up in the early morning and take grandparents from the homes, leaving the grandchildren by themselves, there is ample evidence to show how ICE, as an agency, has been abusive and has harmed many residents of San Diego County. And it's imperative then that as sheriff must comply with local board policy, L2, the appeal ordinance, and state, and the spirit of SB 54 as well. The spirit which recognizes what Californians want when we talk about the decency of protecting those that are the most vulnerable in our communities. They deserve dignity, they deserve respect. Please comply with the policies at hand,
Okay, not seeing any movement in the chamber. For the next three speakers, Jacob Durante, Patricia Serrano, and Lupe.
My name is Jacob Borsay, and I represent the San Diego LGBT Community Center. I'm here because this isn't an immigration issue. When the sheriff uses county tax dollars to notify ICE, transfer community members, and work around SB 54, that's our money being spent against the very people this county is supposed to protect. California was clear when it passed the Values Act. San Diego County was direct in passing the clear ordinance. The sheriff is out of step, but bold. And there is something deeply hypocritical about an agency that justifies deportations in the name of the law, while simultaneously breaking California law to carry them out. Our communities, including many LGBTQ immigrants, already face enormous barriers to trusting law enforcement. Every ICE transfer notification, every loophole exploited makes that worse. People stop calling 911. People stop reporting crimes. That makes us all less safe. The board has the authority and the obligation to act. We are asking you to use it. Stop spending our resources on deportations. Thank you.
Thank you. Next speaker, please.
Buenas tardes, mi nombre es Patricia Serrano. I live in my county, and I'm testifying that it's collaborating with ICE is more harm than good for our communities. When Sheriff helps DHS and ICE agencies with the protection of our community members, they further undermine the trust and confidence in law enforcement, making our communities and families feel less safe. Immigrants and communities of color know that interacting with law enforcement often has extremely harmful impacts, resulting in incarceration, detention, and deportation. People are less likely to report crimes when victims and witnesses fear they may be deported when they come in contact with local law enforcement. So please comply with the law.
Thank you. I'd like to invite one of the remaining speakers in person, Christy Byers and Julie Diaz-Martinez.
Hello everyone, my name is Lupa and I'm here on behalf of Mid-City CAN, an organization based in City Heights, a community that has been heavily impacted by our current climate but continues to advocate for a safe and better community. Earlier this year, this board passed a clear ordinance indicating the importance of signed judicial warrants. We hope that this year this ordinance is implemented properly, because we saw that out of the 3 transfers made in 2025, 30 did not have signed judicial warrants. The city of San Diego and the county have established policies to keep people safe, and we ask that their jurisdiction is respected, because our communities are scared and losing trust in law enforcement and know your rights trainings. Thank you all for your time.
Julie Diaz-Martinez. I am a Democratic, I'm elected to the Central Committee, and I represent North County, the community that's most impacted by ICE transfers. We in our community are really upset with the tripling of ICE transfers by our sheriff in this community. We hear the sheriff cite her autonomy as being an elected leader. However, she is violating the very rules and policies that you as a board have established. You have a tool to monitor this. Are you aware that the 2 largest counties in the state of California, both Los Angeles and San Bernardino, have passed measures in which a sheriff can be impeached for just cause? You have the ability to stand in between the community and ICE. Thank you.
Thank you. Before we begin to hear from the callers, I'd like to do one final call for the individuals that we previously called forward. Cesar Javier, Michael Brendo, Mark, Fiona Martinez, Alexandra, and Christy Byers.
My name is Carol Stevenson. I submitted, but my name didn't come up, so it's okay to speak.
Yes, we have you as a call. Go ahead.
So my name is Carol Stevenson. I live in District 3. I'm a member of Showing Up for Racial Justice. And I've been coming to street platforms for years now. This year feels different. We've been asking for no collaboration with ICE. And really this year we have seen things, the scale just grow so enormously that we can't deny how horrific our community is being impacted. And there's so many groups like Surge and really other organizations, volunteer organizations, people just on their own, taking care of our community right now because of the devastation that ICE is causing. And people are just doing what they're able to do. We're doing what's in our power to do. And we're asking you to do what's in your power to do, which is to end San Diego jail's collaboration with ICE, stopping the transfers, stopping the holes, and getting ICE out of San Diego.
Thank you. We'll now hear from the individuals who have requested to speak by phone. We will begin with our first caller.
Although deputy and sheriff use ARGIS, the Automated Regional Justice Information System, part of CANDAG, the County Transportation Agency. Strict limits need to be put on data sharing and AI operations at ARGIS. ARGIS records are got 65 local, state, and federal agencies, 5,000 users, including national instance-based reporting system. And we know officers who might access the system that they do have poor training, and it wants to send your data to the cloud, which has been hacked so often data there is not safer. There may be less incidents, but who knows where your data might end up. IBM sells the largest ground-based data storage system, which are...
Thank you. Here's the next caller.
And I'm an advocate for America, and yes, one of the speakers in the group says immigration is a problem. America is the only country in the world where an individual can enter illegally, be provided never-ending freebies and special privileges not granted to Americans, such as being above the law. The sheriff's policy is a guide on how not to offend the felon who's in this country illegally. More transfers are needed. The county sanctuary status, the sheriff's policies, and the state law confirm priority is of the illegal immigrants, even those convicted of felonies, to be above Americans and legal residents. This is shameful. What about the 2 children who were killed, allegedly, by illegal immigrants in this county in November? So they're separated from their families. Anybody who's here illegally can self-deport. Let's consider that and stop giving special privileges instead of above the rights of Americans.
Hey Andrew, before you start my time, can I get a translator? Because I'm going to say this in Spanish.
Yes, we have a translator available. The translator will come to the podium, and we will have 2 minutes to address the board.
Gracias, señor.
Thank you, sir.
Otter. Okay, Consuelo. Violaciones de derechos humanos
of the human rights
a la mayoría de estas personas no les importa cuando las fronteras
for the majority of the people that don't care about the borders.
No les importó cuando las fronteras se desbordaban.
They didn't care when the borders were drowning.
That's what it says. Ni cuando niñas y mujeres eran violadas tras cruzarlas.
Neither did they care about the women or the girls that were raped in the crossings.
Entonces nadie les dijo que se indignaran.
At that time, nobody told them to indignate themselves or be indignant.
Esta indignación selectiva ya cansa.
This selective indignation is getting tiring.
Manufactured outrage. Es increíble lo fácil que es manipular y coaccionar a la gente.
It is incredible how people can manipulate others or people.
Thank you. We'll hear from the next caller.
It's true that the untruth forum will bring 50-part questions for the sheriff. This county state is colluding with drunk drivers, rapists, and murderers of our neighbors. 8-year-old Aria Cynthia Cruz was killed on a county road in Julian by an illegal alien criminal who wasn't deported thanks to SB 54. Aria's mother is now in a wheelchair, and her Marine father has a traumatic brain injury. Where is that local family's activist lawyers? Due process reform. They're Hispanics too, but I guess because they're American citizens, they don't matter. Only deportations do. In reality, 8 U.S.C. Section 1373 says that, quote, nothing prohibits or restricts or receiving information regarding a person's immigration or citizenship status to or from federal immigration enforcement. Federal law. And this board has jurisdiction over the sheriff or ICE and people else living in this country. We should be deported. If you're here illegally, you are a other than a detainer to leave.
make sure that we have something cleared up real quick. All these rules came about after you made it extremely easy for anyone filling out mass amounts of registration cards to also gain access to those ballots and vote for them. That is protected by the NVRA regulations. You can go in and take a look at all the laws that you're standing behind. All those are off of faulty elections, which I've been bringing up, which is why I was fired, which is why you guys spent millions of dollars trying to silence me, you fucking cunt. Do you understand that I have been easy on you? I could go ahead and make shit work. We could go ahead and push this over. I'm not going to go ahead and violate any laws. But you're going to go ahead and abuse your fucking power because Uncle Damon is right there to hold all the flames in power, right? To make sure that they all obey by...
Hi, Felicia Gomez with the California Immigrant Policy Center, the Fuera Migra Working Group, and District 5 resident. I'm here tonight to urge the sheriff to stop all collaboration with ICE. There is absolutely no reason why we should be using precious local resources to do ICE jobs for them when HR 1 is providing $170 billion to DHS, more than most money to militaries in the world, and when our state and county budgets are being slashed. For the second year in a row, ICE is relying on judicial warrants to facilitate transfers and get around SB 54. Sheriff Martinez says this is happening because of Operation Guardian Angel. However, this only applies to the Central District of California, which SB is not a part of. In fact, the SDSO confirmed this in a response they provided to a PRA we submitted in October 2025, noting that the department did not have responsive records because Operation Guardian Angel did not apply to just them. Why is the sheriff now claiming Operation Guardian Angel now applies to our department, and how long has this been going on? We demand transparency around this shift in policy. Any transfer, regardless of if there's a judicial warrant or not, is unjust and causes irreparable harm to our communities.
We'll now hear from the final caller.
Hi, Blair Beekman. I'm kind of one-dimensional on these sort of items, but they're kind of important to me. I believe there can be many ways to interpret legal matters in terms of immigration. I believe that working towards civil rights is an important aspect to address immigration. The city of Oakland has been working on their flock issues and working towards, in the next 2 years, they're going to be leaving flock, and the community develops new plans for a new LPR vendor. SANDAC is reviewing their community surveillance process. So there are constructive choices we have in these sort of questions at this time, and we're not, completely locked out of working on good projects. Good luck what we can be working on. The city of San Diego also questions their data collection practices and what's best. And it's a community effort. They're looking at community effort.
Thank you. Chair Ross Greenberg, that concludes public comment from the side.
Okay, thank you very much. Colleagues, this is now our opportunity to have questions or discussion. So if anyone wants to kick us off, any questions or thoughts or comments? Oh, I didn't see. Sorry. Please go ahead, Chairperson here.
Thank you, Chair. I have some comments and then some questions. I want to begin by acknowledging what we heard tonight. The community members who came and spoke, to those who submitted questions, and all of the organizations who presented, including the San Diego Immigrant Rights Consortium. Thank you for bringing both data and lived experience into this space. I don't need to repeat this, but we know we're living in a time where fear is real in our communities. I would even call it terror. Families are afraid to go to work, afraid to take their kids to school, afraid to seek medical care, afraid to call law enforcement when they need help. We heard that clearly tonight, and we hear it over and over again. I do want to acknowledge the sheriff and her team for being here tonight and for the presentation. We all understand that there is a legal framework grappling with here tonight is not just about what is legal, but what is the true impact of what we're experiencing. So we do see 83 transfers to ICE custody in 2025, with the majority tied to federal judicial warrants. We see over 1,000 notifications to ICE regarding individuals in custody. And we heard from community organizations that transfers have increased significantly, and many occurred without judicial warrants, and in other cases, individuals who reported even being U.S. born were still transferred. So our conversation, I believe, tonight requires transparency, it requires accountability. So the questions I'm going to ask are grounded in the data we've seen, the concerns we've heard, and the lived experiences that we've shared tonight. They're meant to get clear answers on how federal judicial warrants are being used in practice, how discretion is being exercised, how we are ensuring that no one is wrongfully transferred, and how county policy and state law are being interpreted and applied. Because at the end of the day, public safety and community trust are not in conflict. They depend on each other. So with that being said, I'd like to ask the first question. We've seen that a significant portion of transfers are tied to federal judicial warrants. When those warrants are presented, and this is for Sheriff Martinez, does your office conduct an independent review before transferring someone, or are those transfers effectively automatic? And if discretion exists, how is it actually being exercised in those cases?
So you're talking specifically about judicial warrants?
Yes.
What kind of a review are you asking if we conduct? We validate the warrants, we verify the warrant is valid and validly signed by a federal judge. And under that, I have to comply with the federal warrant. And so we notify ICE if we receive that warrant and they're in our custody, then ICE can pick them up on the case.
Can you walk me through what that would look like?
We receive a judicial warrant. I believe I'm going to ask Lily to come out. She's the one who's in charge of that program.
Good evening. So the Detention Processing Division has certain methods to receive judicial warrants. That includes federal warrants, that includes warrants from other law enforcement agencies. When we receive those federal warrants, they're received through those avenues, which are secure. We don't accept anything outside, excuse me, we don't accept the warrants outside of those avenues. So beyond getting it from that type of processing, we don't verify anything other than validate that it is an active warrant.
So basically, it's a secure law enforcement system that sends us the warrant. Only a valid law enforcement agency would be able to send it. They're signed by a federal judicial authority, and then they validate that it's an active warrant before we do release.
And the assumption is that it would be for a violent offense.
No, it's for a federal immigration offense or a violation of federal law. It's a federal warrant. It probably wouldn't be applicable to a state law violation. It would be a federal law violation.
And then once you receive that, you mentioned you make the transfer. How do you make the transfer?
So when it is a federal warrant, the agencies contact us in order to do a scheduled pickup. Since warrants, federal warrants are outside of SB 54, we do schedule the transfer pickup with immigration.
Where do those happen?
Those happen within the secured area of the facility, the final release area.
Which facilities?
All facilities have final release areas. They have secured areas to be able to process that exchange.
Is it indoor or outdoor?
It's all indoor. It's within the detention facility.
Thank you. What safeguards are in place within your office to ensure that every transfer strictly meets SB 54 criteria, including verifying qualifying convictions, timelines, and identity? And have there been any instances where a transfer was later found to be inconsistent with those requirements?
Sorry, maybe she'll stay up here for a minute.
Do you need me to repeat the question?
Would you please?
What safeguards are in place within your office to ensure that every transfer strictly meets SB 54 criteria, including verifying qualifying convictions, timelines, and identity? And have there been any instances where a transfer was later found to be inconsistent with those requirements?
So this is gonna be a team response, and I'm going to bring it, it's okay, our jail population management unit lieutenant, because we work in tandem with this unit to be able to do that process.
Good evening, Board. Matthew Jensen, Lieutenant with San Diego Sheriff's Department, our JPD unit, or Jail Population Management. So our staff uses our databases that are the law enforcement databases to look up criminal charges and history to ensure that the penal codes that are set forth for the felonies that SB 54 are screened that the person is the one that is tied to those felony charges or felony charges that SB 54 is set forth, and they screen that, verify, make sure that they actually do the criteria.
Have you ever had a case where that was inconsistent, or transfer was not consistent with those requirements?
Not that I'm aware. Not that I'm aware.
Okay, thank you. So this is, I think, one that's of high interest to the community, and we've heard this question over and over. What is your office? Your office is using, technically, county-funded staff time and resources to screen individuals, issue notifications, coordinate with federal agencies, and facilitate transfers. Can you provide a clear accounting of the total public cost of these activities in 2025, including staff hours, administrative processing, and any indirect costs?
No, we don't track that, and we have an increased staff, but we have those staff employees, whether they would do this function or not.
Would you be willing to do an analysis of that? Would it behoove us to actually have that number, given that we are facing challenging financial times?
Well, the board, if the board decides not to fund those positions, then I won't be able to do all of the other functions of the jail population management unit and the processing unit, which is very critical to processing court paperwork and things like that. For me to separate out how many minutes in the day they might spend making a phone call or processing paper would be pretty labor intensive for my team.
Okay, given everything we've heard tonight, from the data to community testimony, what changes, if any, is your office willing to make to ensure full alignment with both state law and our county's values?
Well, I hear the community very strongly, that feel very strongly that it's much safer for our community, and it's much safer for the individual who's in custody, and it's much safer for the agents who are picking up these individuals, that they pick them up in a safe environment of a jail setting. They're going to be looking for them anyway. They know who's in our custody anyway. They know who has criminal charges anyway. If they're going to go into the community, there will be collateral damage, and that's my bigger concern.
Wouldn't it be safe to say that the activities that ICE has engaged in that are basically sowing fear and terror in our communities, because there's no due process being observed, there even being citizens being arrested? We've heard the hesitation from people to call law enforcement. That makes us safer.
I am hearing different stories from different community members. We have very strong relationships with our immigrant communities, particularly in the North County, and they voice very strongly that they don't want a child molester released back in their community. These people will continue to reoffend and victimize those communities. They're not victimizing other communities, they're victimizing our immigrant communities, and I get a lot of concern from community members that I would do anything differently, or that I would unleash potentially ICE to target their communities because they're looking for an individual that they wanted from the jail.
And I would say that I don't think any of us wants a child molester out in the community. I think that's something we can agree on. The problem is that if we're not seeing ICE observe legal due process, or if they're detaining people without perhaps even charges against them, then, there's a case to be made to go the other way as well.
Well, that's what I see them doing in the community. The people they're picking up in the jail, they are following the process with a judicial warrant. Those 50-some individuals had a judicial warrant. The other individuals have a criminal conviction, which makes them in violation of not only
allows me to do what I'm doing, but also makes them in violation of federal law. So I think there's a much stronger case to be made that due process will be followed if we follow SB 54 than if they go into the communities and are contacting people without the benefit of the judicial warrant.
Okay, I am going to thank you, Sheriff, because there and for my colleagues to ask questions as well. I have more comments, please.
Okay, thank you very much.
Thank you, Sheriff, for the presentation and for members of the public who continue year after year to be engaged in this forum. I think it's important to reiterate something that one of is that the reason that we are here and that we have to hold the Truth Act forum is because there's continued cooperation with ICE, right, to access individuals. And so without that, we would not need to be here year after year. And on display is what is clearly a difference of philosophy around what makes people feel safe and what doesn't. So I think we've heard a lot of that, those opinions. I continue to hear those opinions. I have opinions of my own, obviously. I don't think I have to tell you. But that's kind of what it boils down to, and there's a lot of legal justification on either side. I think one of the most important things here is, I have a lot of concerns, but I was focused on this one. And that is, we know that the president is going to make sure that ICE gets their money. He's holding up airports and everything else right now to make sure that they get their money. Why on God's green earth, when we are in a budget situation the way that we're in, are we helping and participating? I've gotten calls from people that would not be in the chambers with immigrant advocates. Okay, they wouldn't be here. They don't agree with a lot of the values that our community members and many of our advocates hold, but they still are having issues with seeing deputies with ICE raiding certain communities. They just, whether they are landlords or whatever else, I'm receiving those calls. And so in a budget time where, I spent 12 hours in Sacramento on Tuesday. I'll update the board on that either today or tomorrow. With all of our officials saying, we're going to be $300 million short. This is going to be our annual hit based on HR 1. The same president who made sure that got through Congress is also making sure that we're not even separating out TSA and people are going hungry on their 4th pay period where they haven't received money. Yet we're helping the federal immigration enforcement officials that he's going to make sure get paid. When we don't know what's going to happen to our sheriff's department, to our self-sufficiency workers. We don't know. So all I'm asking is a partnership to try to, we know that it's hard to do it in real time, but to give us some sort of estimate or create some sort of methodology where you are calculating how much we're cooperating and what it's costing us.
I didn't say I wouldn't, Supervisor. I said that I have to look at how time-consuming that is for my staff. We are very much at capacity in our jail system right now, as you all know, and I've told you many, many times. But for me to say, make some promise here tonight that I don't know that we can uphold is irresponsible in my opinion.
Okay, well, you said you would try, and I appreciate that. What I am talking about, I know there's the issue around the jails and the transfer that is going on there that has to do with the warrants. We've heard direct testimony about how that does impact families. I have heard also about out in the community, on the streets as well, where ICE and the sheriff deputies have been in partnership.
That's categorically false, and I think those are perceptions people have. We're not cooperating and working with ICE to support the immigration. If there's activity in the community, the occasions we've had, we've been very transparent after we've done our research and seen what occurred. We had an incident, I think it was 2 weeks ago at North Coastal Station, where ICE used our public parking lot for some staging. We weren't aware they were there. They left before we were able to find out what's going on. We put out a press release. We communicated with our community community, you talk to the city council, I took phone calls from senators over that. I know how sensitive this is to the community. I know what it looks like when they see law enforcement. We do joint operations with the FBI, with other folks. We don't do joint operations with ICE. If they do conduct an activity in the community, it causes some disruption or there's something that goes on. Typically what happens is community members call us, we respond. Same with San Diego Police or anyone else. We're basically just going to see what's occurring. We're responding to a call for service. Our goal is to de-escalate, calm the situation, see what's going on, understand the activity that's going on, keep everyone safe.
Okay, well, I'm gonna go back to you trying to, in some kind of way, develop a methodology for us to be able to determine how much this is.
I appreciate that.
No matter what we end up doing with that information, I think it's just super important that we look at it from that lens. Because philosophically, there's a lot of different opinions, but as far as our budget is concerned and the constraints that we face, I think that is just worth having the conversation. So I appreciate that, and I know it's been a long day for you as well. But the last thing I'll say is that information is very important to me, which is why we had the exchange earlier today, is because as much information as I have, I can then be able to justify to the community why we're making the decisions that we're making. That is very important to me, especially in a time like this, where I feel like I want to be able to fund the things that people need so that your folks don't have to encounter it, right? So I'm trying to balance, what housing looks like and what all these other things look like, so that you all can do what you do best and deal with the most violent offenders, right? And so that's just my philosophy and how I'll be approaching this further. So thank you again for the conversation.
Thank you very much to my colleagues. First of all, I just really want to thank all the community members who are here. I know it's late. I know people came from work, people left their kids at home, and really made an effort to be part of this incredibly important dialogue in our community. And I want to uplift and echo the comments of my colleagues that while this has been a conversation in our community for a long time, there's a way in which the moment feels really fraught and really different right now. And obviously that's being driven by the way in which the Trump administration is continuing to terrorize communities by weaponizing ICE as, in many ways, a private police force that's very scary. I think very scary constitutionally. We've seen really horrible things happening across our country by ICE agents that are empowered and poorly trained and then sent out. And people are being killed. And it's very scary. People are being disappeared into jails in other countries. And for whatever kind of convergences or divergences that I think many folks in San Diego have about sort of the nuances of immigration law and immigration enforcement, there's no question that this is somehow a really different and really scary moment. So I just wanted to center that and acknowledge that we really have to be, as much as this is always an important issue, that this is an issue now that's really centered and I think is veering us as a country towards a constitutional crisis, to be quite honest and to be quite frank. So I just wanted to say that that's what's really centered for me as kind of we think about this. I appreciate the focus of my colleague, Vice Chair, on budgetary implications. I think we all know that we really do have incredibly limited resources at this moment, especially as so much of what we've relied on in our community is under attack and is being cut back, while those funds are then being reallocated to ICE. And so I don't think we want to be part of that here in San Diego County. And Sheriff Martinez, I appreciate your willingness to try to figure out, the costs. Of course, let's not make the costs even higher by spending so much time calculating the costs, that it's costly to calculate the costs. But, you know, I think there's probably some kind of estimate, I think you all could probably come up with that would be helpful for us to know. I actually had questions that came, frankly, from a different source. I was contacted by a reporter regarding an article, regarding some reporting, and that this would be a good opportunity to kind of better understand from your point of view what's happening in this situation. So I don't know if you saw this article, it came out just actually 2 hours ago. It says why a corrupt company is investigating rapes at an ICE detention center instead of the sheriff, from Cal Matters. I don't know if you have a chance to
Yes,
see it.
I'm aware of it.
Okay. So I guess I think I just wanted to better understand. Obviously, this is reported by the reporter, but better understand from your perspective. It says, according to the article, it says the MOU that governs how sexual abuse allegations from detained individuals are to be investigated. And so my understanding is that before your department is notified that someone has reported a sexual assault, the private facilities warden, in this case CoreCivic, first determines whether there's enough credible evidence to warrant calling you. So in other words, the CoreCivic is the first, I guess, judge and jury as to whether there's enough credible evidence to call our sheriff to do an investigation. So I'm just trying to make sure I'm fully understanding what you're saying.
Thank you, and I appreciate the opportunity to respond to this. So in context, we do investigate those crimes. In 2024, we investigated an allegation of a staff member who had sexually assaulted someone who was in custody, and that person was prosecuted. We have investigated those in the past. We have not in the last year and a half received any phone calls from someone who's in custody or incarcerated in CoreCivic facilities. We have received one phone call, I believe it was last year, from the warden that there was a PREA incident, which is a Prison Rape Elimination Act incident, where someone in custody made an allegation that someone else in custody had sexually assaulted them. They notified us of that PREA incident, but did not call us back to further investigate it. And the notification came from them, not the individual who was in custody.
Okay. I guess I think just on this article, so I think I'm just trying to wrap my head around it. I think I'm just sort of deeply uncomfortable, frankly, with the idea that CoreCivic would be deciding whether something's bad enough to call you.
I don't know how else we would get notified, though. We don't work in those facilities. We don't have direct access to anybody who's incarcerated in the facilities. They could call the sheriff's office themselves if they had a phone number to call, I guess.
Yeah, I don't know. I mean, I don't have a good answer. I completely understand the logistical problem. If someone is incarcerated, ready, detained, and they don't have a phone, how are they going to call you to make a report? So I think there was something, I mean, I think my colleague and we were there, and it was, did not inspire a lot of confidence in the administration of this facility. And, now we're continuing to get all these reports, right, of people like throwing bottles over the walls, and rapes and assaults, and, all sorts of terrible conditions. And we can't get in there, even though we're supposed to be able to get in there to do a public health inspection. That's our authority, and that's why we're in court now, trying to get in there and check out what the heck is going on, so we can make sure that there's people are being detained in a way that, at the very least, is humane and not dangerous. So I don't have a good answer, to be honest. I understand the operational problem, but there's something about the structure of an MOU that says, hey, CoreCivic, you guys get the first cut at deciding whether this is serious enough to call the sheriff. I'd rather have you guys out there
I appreciate
investigating.
I appreciate that. Everyone wants the sheriff to do the investigation of every facility in the county, including the prisons and the juvenile facilities. Is logistically, as you said, very difficult.
Okay, well, just maybe we can circle back to maybe some ideas or ways of tackling this, but there was other kind of points in the article I wanted to get at. according to this article, it says CoreCivic shows that in 2023, there were 41 sexual abuse and harassment complaints filed at Otay Mesa, including 10 involving staff. Do you know how many of those 41 complaints resulted in a call to your department?
No, we can find out.
Okay. Yeah, I think my request, if possible, would be for you to consider what could be better done. And I understand the logistical challenges, but there's something about an MOU that explicitly delegates to CoreCivic.
Well, we could not have an MOU at all, and they wouldn't report to us, and then we would not investigate. So we have to also work with the, people who are in charge of the facility. The reporting mechanism would have to come from the facility.
Could you have an MOU that you'll come investigate anything that's reported instead
I
of?
don't know if we have the staff capacity for that. Perhaps we could give you a bunch more positions and we could create an investigative unit. It's everything. I completely understand your concern, and it doesn't look like it's an appropriate way to investigate these complaints, but I really don't know how many are occurring. We have our own detention investigation unit that's working overtime on all of the investigations of complaints in our facilities related to everything from sexual assaults to drug investigations to other types of assaults. There's a lot of activity that goes on in any facility. For me to have the capacity to investigate every crime or every sexual assault that's potentially or is alleged in another facility in this county is a difficult task.
I'm hearing you. It makes me really, really troubled and really distressed to hear you say, as a person who has great expertise in this matter, that it might be so overwhelming and so many complaints and so much abuse.
I'm not saying that at all. I don't know how many complaints there are. I don't know how many people speak or what's actually going on. I know what you're saying is in the article.
Yeah, I don't know anything else other than this article either. Yeah. So, and I just got it, so
it's very premature to make this up.
Yeah, I think there's a lot that's not known. I mean, at all, which is why I'm asking you. I think what I would just say at this moment, our best protection in this county is for us to protect ourselves from, I think, the federal overreach that is endangering everyone in our community. And I understand some of the challenges, but I think if we can think together about how we can better, be creative. I appreciate the creativity of county council and kind of trying to figure out how to fight our way in to do our public health inspection. Not sure we're going to win, but we're going to fight. And I think it would be really helpful if we could figure out or think about how the sheriff could be a partner in better holding us accountable, frankly, and making sure that those kinds of pretty horrible abuses are not happening right under our nose.
And I think and I know there's such distrust of federal authorities, but I imagine there's a federal regulatory authority. I just don't know anything about federal facilities or privately owned jails or correctional facilities, so you're not asking an expert. I'm an expert in my own facilities, but I don't know anything about other operations.
Okay. Well, hopefully we can continue this conversation, and now that this is, again, this is very early, this just came out, so, and I just felt like it was helpful and lucky that I had the opportunity to ask these questions here at the Truth Act, but hopefully we can kind of figure out what we can do on this, especially given all these reported sexual assaults, which I find really, really upsetting. Yeah. Okay. Any other questions or comments from any of my colleagues? Thank you. Okay. Thank you again to Sheriff Kelly Martinez for bringing your team here, taking the time to answer all of these questions. Thank you for everyone here, for being here, for participating in the Truth Act Forum. I know how hard it is for you to get here in an evening and make the time, so I really appreciate this. country, the fear and uncertainty around ICE is really, frankly, unprecedented. It's been bad before, but this is a different kind of moment. And I just want to say that anyone who is afraid that I am personally committed and I remain committed and will continue fighting to protect due process and the rule of law and make sure people feel safe and are safe here in San Diego County. These kinds of policies, these kinds of principles, they're not just words, they're principles that have to be reflected in our actions and in our policies. Our work is not over. This is just a